Okay, you're on.
3 to 1. Okay, good? Very good? Okay. Welcome to the Health, Social, Educational, and Environmental Committee meeting. Please stand for the pledge. Legislator Russo, can you please lead us? Sure.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Roll call.
Legislator Ellner.
Here.
Legislator Russo.
Here.
Chairwoman Adenizio.
Present. Moving on to number 3 is the acceptance of minutes from March 18th, 2025. Number 4 is a discussion on the update of the JUUL settlement from the Health Department. Would you like to come up? Is there anyone here that would like to be on? And Shannon. How are you?
Good. How are you?
So it looks like we anticipate receiving $500,000 from the settlement?
Correct. So, and tonight's session is really meant to be informational.
Right.
So this evening, Shanna Siegel.
Sorry, I just want to make sure I sent the link to this, but it's a website, so I just printed it so that you could
Make a motion.
It's not, I mean, is it
Oh,
additional?
yeah,
It is.
It's
Yeah.
additional. I make a motion to accept the additional. Do I have a second? All in favor?
Aye. Thank you. The website, you couldn't attach a PDF of the website, so I wanted to make sure you had it.
On computer? Or my, oh, sure.
No problem. So again, Shanna will be updating the legislature regarding the status of the JUUL settlement disbursements, limited use, and timelines. So please.
Thank you. So as those kind of papers make their rounds, and as our request had mentioned, the JUUL settlement is related to a multi-state lawsuit that New York was a part of against JUUL, the manufacturers of the electronic nicotine delivery system, so known as the vape. And so our portion of this settlement that comes down from the state is within your packets there. You can also see other counties' disbursements, as well as BOCES disbursements related to that. So we just kind of wanted to give you this FYI tonight. We don't have the money yet. We should have received it in earlier this year, but the Attorney General's office is delayed with their disbursements. So Mike Lewis, Commissioner of Finance, and I have both contacted the Attorney General's office. They have everything they need from us in order to do the disbursements. It'll look a little bit differently than what they originally intended. It looks like we should be getting our first 2 disbursements within the next couple of weeks. This happened the last couple of weeks. And as you can see, there are certain allowable expenses, approved uses of this money. It pretty much mirrors what we've discussed before about how we in this county utilize the fines that are collected through the ATUPA program. So very much similar: enforcement, education, prevention, and cessation. So it goes kind of back into the work that we're already doing. But because we've also seen the fines, the fines that have been collected through ATUPA increasing, we, over the past couple of years, you might remember that we conducted an assessment with our community partners about what our needs were as it relates to addressing youth vaping in particular. So we would like to kind of update that assessment, get input from our same community partners who work in those areas of mostly prevention and education. When it comes to enforcement, that's really a health department specific activity, to ensure that we're reassessing where the needs are and if they're different than they were a couple of years ago. But it's wonderful to receive more funding.
Oh, sure.
It is a little frustrating when it is very limited in its scope. As we know, the impact of vaping has a much larger impact than just education about prevention as well as cessation. There are already people that are impacted by chronic disease because of it. So not being able to address some of those factors is sort of frustrating, as well as like vaping disposal, which impacts the environment. So there's a lot of pieces that we in public health, local health departments have been pushing the Attorney General's office and the State Health Department to sort of get more clarity for us on. One of the questions that we did ask in a webinar since, between when I made this request and now, we did have a webinar that the Attorney General's office hosted for us to try to answer some of our questions. And one of the places that I did raise and ask them to kind of look further into is if they are making their allowable uses for this money specific to the settlement with JUUL, the language that's in the settlement with JUUL. I understand that that can be quite restrictive, right? Because attorneys made that agreement and I wasn't there for that. But there's this kind of loose term of and other related uses or something like that. You know, I may not have it exactly correct. That was used in the settlement. So I asked them to kind of push further and question what does that mean? Because I can find lots of justification for other uses that are not outlined in front of you there, some of which I just mentioned, that have a real impact on our community. So, happy to take any questions.
Yeah, so just so the public's aware that New York State received $112.7 million, and Putnam County's allocation is $511,067. I said million.
Yes.
Yes. So, anyone have any comments or questions from the committee? Okay. Legislators?
Thank you. How did they come up with this number?
The disbursements, let me pull up my FAQs here to make sure I have the right answer there.
If you look at every county, that's the
It is
same.
population, but it's an age-adjusted population, I think, as well, and I think they have one other factor. It was some sort of nicotine use by county, so if there were disparities among counties that have a higher nicotine use, but I don't know if they did that in an age-adjusted way, so I'll double check.
Yeah, two questions. If it's okay, I think the answer to the first question is no, based on your testimony for giving us information. In 1998, there was a master settlement with respect to the tobacco settlements, and those payments have continued since 1998 and will go into perpetuity. Is this JUUL settlement a perpetual, annual kind of settlement where there'll be money that will be coming each year, or is it just a one shot and a big order to JUUL?
Okay, so my notes from that webinar, which may not be set in stone since we're still kind of waiting on some answers, are that I've written here a lot of confusion about number of payments. After June 1st of each year, disbursements will take place. There was a correction, and the first payment will actually include 3 payments, although they kind of backtracked, and that might be 2. And then the next 5 will each be 1/8 of the total amount. They did originally say that it would be 5 years that we would be allowed to use these funds, but then there was some confusion and pushback on if those could really roll over, because we have yet to see the impact on youth, of the full impact on youth of vaping. So that was another piece that they said they would look into. There's also a chance that JUUL could do like a prepayment of this as well, which would sort of impact how our county receives the funds. So they'd have to give 90 days notice before they were giving a prepayment. So if we got front-loaded a much larger amount, how much time would we have to spend that money down, as well as a little bit confusing right now, gray area.
Thank you. Just one follow-up through the chair. You had said that we're only limited to spend it on certain things, which I'm all in favor of. In particular, you mentioned the ATUPA fines that we get. Is there any mandate, and if there isn't, we should probably have one, that these funds are used to supplement those monies we already spend and not replace them? In other words, I'd like to see a maintenance of effort going on to not only keep level the amount of our own tax dollars that go into this, but I don't want this to replace money that we're already spending. In other words, we should make use of this not as a replacement, but as a supplement. Is there any regulations to that? And if not, we should talk about that during budget season.
Yeah, so interesting, we tried to address that from the kind of the fiscal perspective of, can this money be used to pay for staff who are directly working on these programs? Can it be used for overtime, or to kind of underwrite the salaries of staff? So use this kind of as a grant line, as it might be, to use it to support the funding that we have. But what you bring up is a really interesting perspective as well, because what we are seeing with these increases in the ATUPA fine money is that that may not happen long-term, right? We may hit this peak last year and this year where we're collecting a lot of fine money, and in future years, we might not collect that fine money. So that argument of like holding on to the money till we need it, because that fine money does sustain a lot of the programs right now, because it's so much more than it had been in the past, right? So if in previous years, in health education at the health department, if I had gotten, you know, $1,000 toward our programming, that would have been, you know, a nice thing. Now, you know, there might be tens of thousands of dollars that can go toward the programming, but it's feast or famine, and so, you know, all of this additional money to be used for the same thing, I'd like to see it, you know, used when we need it.
And that's certainly something we would rely on your expertise with during budget time, but not for today, but I'd like to see these dollars be supplemental, not replacement.
Yeah.
Because that would give true value to the settlement as opposed to just throwing it in a bucket and just.
Absolutely,
Okay.
it should be in addition to the other work.
Thank you.
Thank you. Shanna, today's, for the ATUPA settlements or fines that we bring in, that's still part of e-cigarettes, correct? Like, that's included?
Yeah, so and I don't work in that side of the ATUPA program, but the enforcement that we do at the health department, and Rian can speak more to this, is related to sales that are to anyone under age 21, so under in that law, and then flavored vape sales as well. So those are together. When I say ATUPA, I'm talking about both of those.
Right.
I have a couple of questions, if it's okay, if I may.
Sure.
Just go with them, and tag on to that. So there's money allocated to BOCES and school districts, so we don't have to, our funds are not going to be used to address this in school districts throughout the county?
Well, my hope is that we'll get together with Putnam, Northern Westchester, BOCES, as we did with when we started seeing an increase in our ATUPA fine money that was collected. They were one of our partners we met with to see, you know, what are their needs, what are they doing, what aren't they doing, where can public health step in, where can the prevention council step in. So I do intend to speak to the superintendent at BOCES to see what they intend to do with their money, if they're going to disperse it directly to schools, if they're going to do something kind of more regionally with their approach, so we can still kind of support each other. To my knowledge, from our last assessment, they were not in the schools doing vaping education and prevention, which is not in Putnam County schools doing vaping education and prevention, which is why the health department and the prevention council work together, and we are in schools throughout Putnam County doing that education. So certainly we don't need redundancy of efforts.
Well, that brings up my next question, if I may. Sounds like the schools can disperse it to, BOCES can disperse it to other school districts. I know the health department's short-staffed, you know, we've heard that over and over again. We're getting this big chunk of money to address a problem. I don't quite honestly know how the health department is going to solely address this problem. So my question is, are there partnerships or collaborations with local organizations, health clinics that will help ensure the success of this settlement?
Yeah, absolutely. When they first announced the settlement, it did seem that it was going to be even more of a narrow scope, focused solely on the impact on youth, because that's what the lawsuit against JUUL was for. They're marketing toward youth. But since now this webinar, it's been made clear that we can really kind of zoom out a little and speak more about the overall population. And certainly youth is a big part of that focus. So talking about, you know, healthcare providers and other partners that we didn't utilize when we were focusing on just the ATUPA, because that really is specific to youth, how we spend that fine money.
So my question really is, can you pass through the money to another organization to address it?
Yes, and maybe. So that would be for the county to decide. What we do know from from lessons learned from other settlements is that even when we're told that there will be absolutely no reporting required ever, that's not the case. There is going to be reporting required, and when it comes to program implementation and tracking data related to the use of these funds, we want to be really sure that we have the capacity to track that long term, especially if this money does have the ability to roll over time. So we could talk about it. You know, I've been really open internally that I don't know that with this money that is the best thing to do because of its scope of education, prevention, cessation, and enforcement. So we do have a lot of enforcement, and we don't know what kind of enforcement might be coming down the pike for our Environmental Health Services Division at any point because of how complex it is to regulate these facilities. So that's one piece, and then the other piece would be that smoking and vaping cessation programs, the ones that we offer are evidence-based and we offer them for free, but we do want to offer them at times that it's convenient for people, which is usually, you know, after work. And we have not reached youth, even though we now have staff at the health department and at school districts and other places trained to offer cessation for youth. And so I think with the first round, it would be really important before opening anything up to really look at how can we be successful in those endeavors that we haven't gone off the ground yet.
So I think it's fair to say, because this is so new, we don't have a program developed yet for
No,
it.
and thankfully,
I have a whole host of questions. but I
thankfully,
will
we
wait.
won't be doing it on our own either
Yeah.
way, because
Okay.
even when we work like with the Prevention Council, I don't send staff to the schools unless they need me to. So if they don't have staff that can make it, I want our community partners to do their work, and I want to fuel their work. So if I can get staff trained to be backup, then that's what I'll do. And if I can give them the resources and the tools they need to do it, then that's great.
And I expect you'll come back and tell us when your program's developed.
Definitely.
Awesome, thanks. Thank you.
So thank you. I think it's wonderful. You know, I like to see the money coming in, and I want it to be effective. When I first learned about vaping, my kids were in middle school, and our middle school principal was telling us at a PTO meeting that kids are vaping in the bathroom, and that was very concerning to me. I'm like, middle school? These kids are 12, 14 years old. Well, fast forward, my kids, you know, that middle school group is now in their 20s, and they're all still vaping. This is 10 years of vaping that some of these kids have been doing since their middle school years. So, I mean, for me, at the time I wanted prevention. That's peers, and now it's got to be cessation. How do we get them to stop? Because I know a lot of them do. I know this age group very well. They want to stop. They don't want to go to cessation. I mean, they have to be reached somehow, and I hope that this funding can be used for that, because I think it's tragic that these kids are addicted to these JUULs. They cannot stop doing it because the nicotine levels. They're drugging these kids into a lifetime of money going into their corporate pockets. And it's very personal to me. And there's these kids, I mean, you have to know how scared, I mean, some of these kids are that I've talked to. What is this doing to my health? And I cannot quit. So how do we reach these middle school kids who come up and are like, yeah, should have done this? It's like,
And legislator stage, the concern that you have about the very high nicotine
5%
dosages that are in each of these
Insane.
devices, and we're not just talking about devices anymore, right? Now we also know that there's lots of ways that kids are getting exposed to and consuming nicotine. What we've done, and you'll hear more from the Department of Mental Health on our opioid overdose work, but what we've done as a county in, you know, creating a culture that understands what harm reduction means is so vital when it comes to nicotine and tobacco use and cessation as well. So we have, from a public health perspective, and as a nurse and as a mother myself, I've come to really understand that, you know, quitting doesn't work for everybody, but also quitting doesn't mean the same thing for everybody. So somebody quitting a high dose and going to a lower dose is still less harmful. Somebody vaping less frequently is less harmful. Somebody choosing a different device or a different method may be less harmful. And so we need to do less harm for some people. Some people will be able to quit. We should continue offering these cessation options for people. But we really have to go forward with a harm reduction lens. And that's also why I really, even if it doesn't work through the JUUL settlement funds, speaking about, you know, how are we disposing of vapes locally in our county? What does that mean to us? do we feel that that is a place we need to put our efforts, our investment, our education? Because that also says a lot. I know that there are a lot of young people that they may want to quit and they care about their health, but they actually really care about the environment. Some young kids are so focused on an environmental justice issue that if you educated them on what the vapes were doing to the environment or the risk of the lithium batteries in the vapes, they might have more of a push to want to make behavior changes because they care about environment. Some people will be driven by financial reasons. Not everybody is going to be compelled for the same reason either. So it's really, I think, a variety.
And wasn't one of the reasons that they started vaping or invented the product was harm reduction for
Yeah.
cigarettes?
Yes,
And
and that
now we've got a whole new problem.
absolutely, it absolutely changed,
Yeah.
and JUUL was part of the reason that that changed.
Yeah.
And by the way, we all in this room, and
It's all
you know,
harmless.
we all know, why are people vaping, why are people smoking? Why do they continue? They become addicted, but life is stressful too, right? So we have to address the stressors in everyday life for people, young people included. And so if none of this money can be used to offset some of those stressors, which are really our determinants of health, I don't know how effective we are long term. We have to make life a little easier, accessing healthcare, accessing education, accessing transportation. So to me, it's sort of not comprehensive unless we really talk about why are people continuing to pick that up.
Thank you, Chairwoman Admisio. So JUUL's a little bit different because obviously there was a lot of harm done in other ways through its evolution where it was, you know, exploding and there was damage on people's faces and the chargers were not appropriate, and then they switched into a marijuana delivery device and it went off the rails. I understand that this money, I think at some point is going to run out through JUUL because at some point I believe that they're going to go bankrupt, right? But there are many other different options out there for people to choose from. Let's be real, they're all over the place. We have how many smoke shops here? It was one of the first things I did when I got in office was ask. I went to the town of Carmel and I said, can you guys like put some sort of, you know, do something to calm it down? And then when they did the master plan, they actually improved their the way of doing things and how many smoke shops they'd allow and things like that. But separate and above, I mean, we had DARE when I grew up, right? We don't have DARE anymore. DARE is not there. I have 7-year-olds. My 7-year-olds don't necessarily know what a vape is, but would it behoove us to introduce them to, because you don't see a whole lot of people smoking cigarettes anymore. It's actually, I mean, I'm not insulting anybody and I don't mean to, but it's almost like when you do see it or smell it, people will snub their nose a little bit. But you don't see that necessarily when people are vaping. And I think it starts with our youth and letting them know, you know, this is harmful and making them aware of this because they may have an older brother or sister that's doing it and they look up to that person and it's their idol and they don't know that it's a harmful item because they're not being taught about it. So
Yeah.
would it be something that's so terrible to bring something like DARE back to the schools to teach these young kids about, you know, the harms of, you know, vaping and the other issues that are going on?
There are age-appropriate and evidence-based curriculum that is out there for elementary-age children as well. Not specifically talking just about vapes, but about, you know, substance use, about behaviors. We have had in our county elementary school kids bringing a vape to school, being caught with a vape at school. They may not have even known what it was, right? But they did get their hands on it. So I do understand that, like, that exposure starts really young.
Well, that exposure comes from the parents. It's not necessarily from another child or a sibling.
100%.
So this is an issue that's for adults also. Mr. Montgomery.
So what's the timeline we're looking at for a plan and an implementation, and when can we expect to see results?
I'm, you know, until this webinar took place where I felt like I really heard from somebody directly and didn't just get emails telling me that money was coming one day, it didn't feel real. So now that this webinar took place and we have a contact at the AG that we can keep kind of nudging to find out, I think it's time. I did make an initial reach out to BOCES. I first want to find out if they have a plan, and if they don't, that's great and fine too. I want to get together and sort of figure out where the gaps are, and then we'll continue on with our partners. Certainly if there are other thoughts or ideas that, even within the county, we work closely together. So, this is something that came up at the Bridge Alliance. We're talking about substances. We're talking about substance-related calls to 911. This is not necessarily that, but we definitely know that there are 911 calls from students and young people. People are getting sick from high doses of nicotine. So it'll be inside the county, our external partners, our school districts, but thankfully you brought up, healthcare providers too. Certainly that's an area Rion's interested in, collaborating more with as well.
Thank
I
you.
agree. Yeah, because we've not addressed the issues around what's in the suspension fluids.
Right.
We've not addressed the issues around popcorn lungs, increasing diagnosis in adolescents. I mean, so I think there's a lot we can do, sort of leveraging providers in the community as well to sort of message that out.
Just a comment. I think there's also a misnomer out there about JUULs being safer, because when people are buying like vape juice, a lot of that's imported from China and it's coming from sources that we really don't know or understand or is regulated. So a lot of them feel like if this is an American product, it's safer. So they feel that JUUL is safer for some reason. I mean, and that goes to education, I think, as well.
Yes, many of the students that we've interacted with when we do our vaping education and neuroplasticity work, teaching about how the brain grows and develops and the capacity for change and behavior change, don't know how much nicotine is in the devices that they've either used or that their friends are using. And additionally, they don't know what substances are in it, not just the chemicals, but they don't even know it could be synthetic nicotine, which is like not even really known what the effects of synthetic nicotines are. And that kind of unravels a whole lot of other things as well. And you guys know, the Zyn packs as well that fall under this. We did get what I felt was really promising about the feedback we got from the AG's office on this and the State Department of Health was we asked in many different ways. Health departments asked the same question, which was essentially, can we use this money toward programs that are not vape specific but mention vapes? So an example of something that the Co-Occurring System of Care Committee in Putnam County, led by Lauren Johnson, and a lot of us in this room are on it, looked into or is looking into is an evidence promising program, soon to be evidence-based, that's about co-occurring disorders, so mental health and substance use together, and bringing it into the schools. And it's short, it's only, I think, a 3-session curriculum, so it's pretty doable if you're trying to get into a school. It's not like asking to come in for 8 weeks doing something. And there is a curriculum for younger people, but we were looking at, I think, the high school one. And because it does address vaping and smoking and nicotine use in that, but it really addresses mental health and other very important components, yeah, we basically got the okay that, yeah, it could fund programs like that, which is so great, because we don't want to just talk about one thing. We know that this is a complex issue.
Good. Okay, thank you. Anyone from the public? Any comments from the public? Okay, thank you.
Thank you.
Thank you. Moving on to number 5. This is also on for discussion. This is an update. And very exciting that we are one of 3 counties that were selected to receive funding to support the LOST team.
Hi, everybody.
Hi, Sarah.
Hi.
Okay, is there room for you?
Yeah, I'm good.
Okay.
They're doing the talking. I
Okay.
did all the work.
So just so everybody's aware, this is LOSS team, LOSS, which is Local Outreach to Suicide Survivors.
Yes. So we want to give a brief update on the LOST team. We formally launched the LOST team at our mental health forum this May. Marla and Megan are the sort of co-leads of the team, but I want to give a little bit of background about the team to you all. So as you mentioned, we're one of only a few counties that receive funding for this. Now, the funding isn't astronomical, but nonetheless, we're very proud of that distinction. The goal of the team is to be able to provide timely and empathetic support to folks who have experienced a loss to suicide. Studies have shown that the faster that we can get resources and support to people who've experienced such a loss, it significantly decreases the time that people are able to sort of receive help and begin their recovery journey. So we're talking about the difference between years and months. So this, this program that we're launching is very, very meaningful, and we're very excited about it.
Excuse me, 1 second.
Sure.
Motion to accept the additional, do I have a second?
Second.
All in
Can I
favor?
just,
Aye.
for a second, can we just, I'm really excited about this, and
Sure.
can we introduce you as well, so you guys
Sure.
we have a lot of people from the public here, and you guys are all really important people
Sure.
in the county that do the great work of the county. So I think it's great for these guys to know.
Absolutely.
By my through the chair.
No, not a problem. Thank you for that. So my name is Paul Tang. I'm the Director of Mental Health. I started here with the county in October. So I'm still telling everybody I'm still new. And I'm going to keep on saying that until I can't say that anymore.
Marla Baylor. I'm Director of the Child Advocacy Center in Putnam County, and I also co-chair the Suicide Prevention Task Force.
I'm Megan Castellano. I work for Guardian Revival and co-chair the task force with Marla for the last 11 years, and prior to that, I was the director of the Mental Health Association here in Putnam County for 25 years.
They do great work.
Thank you.
Yes.
Thank you.
So I want to let Marla and Megan talk a little bit about what we actually do with the LOSS team, because they've actually deployed a couple times since we started. But just a little bit more background, please forgive me, is so the team consists of the three of us, Commissioner Servadio, as far as the staffing component, but we're also very, very happy to say that we have a peer element as well. So we've asked people who have experienced a loss to suicide to join us. And that's a really important part of the team, because having that lived experience is really important to be able to connect with folks who've also experienced a loss. So we've made contact with a few folks who are willing to join us. They've gone through some some training through the American Foundation for Suicide Prevention. And so the idea is to have one of us go out with a peer to make contact, ideally as soon as possible, but we can deploy at any time. So, Molly, you want to talk a little bit about your experience?
Sure. Thank you. You said a lot as far as the backstory for the program. So do you guys have a copy of the PowerPoint slides? There were just a couple things in here that I just wanted to reference as far as the impact of the program. The one that has the impact of suicide, that talks about the suicide exposed, suicide affected, suicide bereaved short term, and suicide bereaved long term. This just illustrates the sphere of impact, and I just want to note the impact on our first responders, and just many of you know that because our community is small and a lot of our first responder departments are volunteers, this increases the individuals who may be affected. They may go from being exposed to being more affected or bereaved, whether that be short-term or long-term. So I just wanted to make you aware of that, and then the rest of the slide is fairly self-explanatory. Paul mentioned earlier about the decrease in the amount of time that people will actually seek help with the intervention of the LOSS team. And based on statistics, the elapsed time went from 3.4 years on average, where someone might seek help after losing someone that they care about to suicide, to 47 days. And I'm just going to say, from my experience with Marla and the 5 responses that we've done with the LOSS team so far this year, we've been able to turn around care for people in as little as the same day, which has been incredible. And a lot of that is, thanks to the commitment to many of the providers in the community who understand why this work is important, and their support has really been invaluable. So we have had 5 responses so far this year. We just had our first in-person response last week. So, and that was very impactful for the person who lost his wife. So we have yet to, there are several different types of responses that's in your packet. It could be an on-scene immediate response, or it could be a delayed response. And a lot of that is, at the discretion of the person who's been impacted. We know, Marla and Paul, and I know from the training that when someone is in this state of severe grief, they have what they call Swiss cheese brain, and so just not able to make decisions because of the overwhelming nature of the stress. So Marla and I agree that our instinct would be to show up, and if they say I'm not ready, then that's fine, but at least to make ourselves available, or at a minimum leave these folders that we just passed around that the task force and the county spent a lot of time developing, and these would be given out. If the task force, I think one of the reasons we got the grant is because we had a folder similar to this that we had been handing out for a long time to be able to give people information after a suicide about support and things that they might need, like contact information for local funeral homes or cleanup services. There are a lot of things that, when people are overwhelmed with grief, they need to make decisions quickly, and it's just difficult to be able to have some of that information readily available. But this is a newer version that was just rebranded and updated to include some other information, and so these are being given out by the coroners here locally, as well as the first responders. So.
And then we also have these, what we're calling our trunk kit. So these will stay with us in our cars, and this is just also additional kind of comfort items and support, just like, there's a little teddy bag, there's children, a teddy bear if there's children involved, and a blanket, and pad and pens and things like that, so they can write down notes. So this will also be given to anyone who's on the scene. And I also want to add, as it was briefly mentioned, that a big part of this is support for our first responders, so that they can focus on the scene and their investigation, and that we can be there to provide that crisis intervention and support to the surviving family members.
And I'm just going to add about the bags. 3 of the responses that we've had so far this year have involved children, young children. Yeah.
And everyone that we've been in contact with is so appreciative.
Yes.
And just, wow, I never knew anything like this existed. Thank you so much. It's really helpful. So
that's been really gratifying for us.
Just so the public is aware, you've been provided with $12,480 for a 2-year cycle.
Thank you. Yes.
It's nothing. It's absolutely nothing. I just wanted to ask you, how do you address any past survivors in need of support? Can people come to you? They, find out about this program?
Sure.
So have you had any success with that? And
I don't think we've had anyone reach out necessarily for past.
No, we are available to do that. We say to everyone that there's no expiration date on grief, and that the grief process is not necessarily linear. So I think as the word starts to get out, we just officially launched in May. We want people to know that we're here. It's fine for them to reach out to us, even if it was something that they've experienced in the past. And we're actually, through the suicide, overdose, fatality review, we're actually reviewing cases, and we're reaching out to family members to try to get information, and then at the same time be able to ensure that they're getting the support that they need moving forward. So yeah.
So this would be for overdose also?
The loss team is not for overdoses. This is really specifically for suicide. However, Marla and I were just talking about this today, that it's a very powerful model. I'm just going to give an example of a response that we had this year where it was a suspected suicide. The person was not located, so it was not able to be confirmed whether or not it was a suicide. So we're still going to respond. And so if there's a question, maybe it's a substance-involved suicide, but it wasn't clearly a suicide. If someone reaches out to us to respond, we're going to come.
Yeah, because I think that would be good. I think that's what we need also.
Yes. And I think a big piece of this will also be assessing resources, like as we start doing this, and we realize, that we need to
can branch out into
exactly. And those are things that will help us identify.
We need more money, though.
We do need more money.
Sure. Our budget is going to be submitted tomorrow. Don't worry.
Oh, make sure you add that in there. Anyone from the committee? Any questions or comments?
I just want to say thank you. This is a great opportunity for people that will need it. So thank you.
Thank you.
Legislator Ellner?
I had an experience where a friend called, they're no longer in the county, but their adult child was in the county, and the county performed a wellness check, and this particular individual ended up in a non-fatal suicide attempt. I lost that friendship because my friend wanted to get information, and being that the attempted suicide was created by an adult, HIPAA and all sorts of privacy cover that. But it's just something to consider. People who have survived, and I see in your PowerPoint that you're kind of directing it towards Commissioner Servidio's troops directly, that loss team is not going to address non-fatal attempts. Is that correct?
Yeah, well, that's correct as far as the loss team, but we are all, I mean, we're all in close communication, so we feel like the community and the providers in the community can kind of handle that.
Because I'm aware of 2 instances where there were non-fatal attempts.
Yeah.
Well,
we need
we
to follow
have
up.
other, within our department, we have means of reaching out to those individuals, and we do.
And I know you have.
Every time we get notification.
But I just want the
of them,
public
we
to
do.
understand.
Yes.
Thank you.
I also wanted to say, I personally reached out with issues with Commissioner Servidio, and it's a little bit of a scene where you don't know exactly how the person's doing, but it's not a police issue, and they have the crisis response team that does show up, that is there, that comes in a non-aggressive vehicle, they're not wearing aggressive clothing, they have a mental health worker there, and they're able to track people, and I assume you guys are working together with all the resources, but through the past 3 years, I've seen such a huge difference in, the mental health we were lacking. We're still not there yet, but we're climbing that mountain to overcome a lot of the challenges that we've had, and I'm very thankful for all of you to give this time, because it's certainly not something that's easy, and it's not something that is hard or easy to go home to and remember these things, and it gives a lot of you, and you're very special people to do that, and we're lucky to have people that are taking on the challenge to continue to battle things like this and find real things that work. So, thank you.
Thank you, Jonke.
Legislative Sagers first.
Oh, I'm sorry.
I mean, when you talked about people finding out about this, if you don't know about this, you don't want to know about it,
Right.
and it's only something that you want to find out after the fact, But I forgot my question.
Outreach.
Oh, how many other counties have this available? Because I think when you need it, you really need it.
In Putnam, in New York State, we're one of 3 that are piloting this. So 3 counties were funded to implement this in New York State. Across the country,
I think in the PowerPoint,
I
there is
did
a slide
see-
that shows
I
about
mean, I
the
looked at
states
my-
where there are loss teams, so again.
But in New York State, there's 3 counties.
correct.
Good county.
It's in Hampshire.
Madison County, I believe, is one.
Madison, Chautauqua, and Tioga.
Thank you.
Is there a reason for that? That those 3 are 3 pilots, or just willingness to do it?
I think there's a couple of reasons. One is what I mentioned earlier. I think that they were strategic about where they allocated the resources based on who might have the best chance for success. And I'm just going to say from my experience, Putnam is a great county to pilot things. We're small, we get things done, people in the community, come together to, meet challenges. So, and I can't speak for the other counties, but, I just know that our liaison at the Suicide Prevention Center of New York, really encouraged us to apply because they knew about the postvention work that we were doing. And Legislator Ellner was speaking earlier about, it's in the PowerPoint, there's a whole different stages, prevention, intervention, and postvention, and this would be considered postvention, but a lot of that can lend itself to prevention work. So we have been doing really well with that, so that may be the reason why.
I think it's also identifying a gap in service that we have identified for years in Putnam County, which is great. And Sheriff McConville was a huge advocate for us receiving this funding at the beginning. And yes, it is a small amount of money, and we are getting creative with how we're going to expand over the next few years. I think that our coroner is one of our coroners. We have multiple. John Borges has been a great partner for us in getting this off the ground. So,
Was there any reason choosing Putnam? Is our rate of suicide high in comparison to our population?
no.
It's consistent.
Yeah.
Okay. Legislator Jonke.
Yep. I want to say thank you to all of you for all the hard work. It's because of you and your work that we have the reputation of a county that gets things done. So thank you. I do want the public to be aware that if they want to, this is a pretty heavy PowerPoint in here. It's in the backup, which you can find on the legislative website. And also there's a website, which is putnamcountyny.gov/hope/suicide prevention for anybody in the public who wants to see exactly what you're working on.
It's linked to our website as well, Legislator, so the mental health.
Mental
and
health.
social services.
Okay.
And on that note, I do want to add that we are actively recruiting volunteers who might have had a lived experience that would like to work with us and be part of our team. So that's also on the website if anyone is interested in signing up for volunteering.
I'm gonna also, if it's okay, pass these around, because what Legislator Sage also said was, you know, I have the crisis hotline number and the 988 number on my refrigerator in my house. I know those numbers. I don't always gonna get a call from someone who maybe just happened to me recently with my best friend, she needed help with her daughter. So we have these cards, so I'm just gonna pass these around also and just ask that you could make them visible and maybe be ambassadors for us to let people know that we're here and what we have to offer.
Mr. Montgomery.
Yeah. First a question and then a comment of the impact of suicide list here. That's a massive list of those affected. And would your services reach out to first responders?
Yes, we do.
And that's part of our outreach and with the five activations responses that we've had already this year. That has been part of it, is that we've asked for the names of the first responders that are on scene, and we've also done, just check-in calls with them, and, we're not department connected, just for us to say, we just want to make sure that you're okay, you were on the scene, you heard it was, whatever it was, and if you need anything, we're here, and to please reach out, and Guardian Revival has, their talk line, and that's all peers as well, so it's an opportunity for them to be able to get support if they need that.
Thank you for that support. $12,000 goes a long way. I really thank you for your work. I have to thank the Putnam County Sheriff's Department, who has been doing this work before any of these teams were established. So they're the ones, our deputies are going on scene for, that's what we've had here since the beginning of time, is our cops coming up and showing up on a scene and having to deal with it, and they deal with it very well.
We actually heard from the last response that we had, how much they appreciated the response from law enforcement, that they were very sensitive to the scene, as it may have impacted this survivor, and how grateful they were for that. And we were really happy to share that information with the responders as well, because I don't think they hear enough compliments.
No, it's hard to, once you experience that, to revisit and thank them.
Correct.
So, and we do thank them.
Anyone else? Anyone from the public have any comments? No questions or comments?
Just a quick question. Oliver Goldstein from Kent. I wasn't aware of this.
Okay, could you just stand up? Okay, could you stand up?
Just a quick question. Oliver Goldstein from Kent. I wasn't aware of this. The program sounds terrific. And I was just curious. It sounds like a lot of the services that you're providing could be useful to kids who have lost parents or losses separate from suicide. I know that would be a massive expansion of the mission, but I'm wondering if that's something that we contemplate. It just feels like some of this stuff would be transferable more broadly.
It is, yes, and we are.
The sound is cutting in and out
resources
on the
available.
mics.
We are doing a better job of updating our
Just to make
website
sure
to
everybody talks
include
over
all
my
of our providers and the resources available, so we should expect that to
What's the name and town?
Yes.
Yeah, I got it. Thank you.
Okay. Okay, I just want to, if you could speak closer into the microphones, because the live feed is very unclear when we try to watch it. We don't know what anyone's saying. So if you can get close. Do you have a microphone, Sarah? No.
I'll speak louder.
She's not speaking.
We're moving on to fatality review.
Yes.
If any of you have any questions or issues or concerns, comments on our loss team, please just reach out to me and we'll discuss it further.
Okay, thank you.
This is not an easy topic. Our next as well, so, Paul, you wanna go
Sure.
through our fatality review?
Sure, so related, we are in the process of choosing cases for our first suicide overdose fatality review. So we did a mock review in April? Yeah, April. And we asked a lot of the providers in the community to come out and participate in our mock, and felt like it was very successful. We feel very ready to launch our official review in October. For those who don't know, suicide overdose fatality review is essentially a case review. We'll choose one suicide and one overdose to review in detail. So we have two teams. Marla and Megan, again, are through their work for the Suicide Prevention Task Force, are the leads on the suicide fatality review team. Lauren Johnson and Shanna Siegel are the co-leads on the overdose fatality review side. So they're each taking charge of each of those two separate reviews. I will be the facilitator for the review, which will include going through a timeline. We are planning on doing next of kin interviews for people who have lost somebody. And with that, we'll be able to put together a very comprehensive sort of narrative of this individual's life. And I want to sort of really make it clear that this is about individual people who have been lost. We're not talking about statistics or names on a page. These are people. And so part of my goal is to really maintain the humanity of the folks who have been lost, because these are, somebody's husband, wife, daughter, son. And we want to really do that justice when we're doing these reviews. Our goal is to find, system gaps, system improvements that we can make, something that maybe could have saved a life and will hopefully save a life in the future. It's not about pointing fingers and blaming, somebody for, not doing something or judging choices that people made. It's really about trying to make things better. So that's our goal. Any questions about that?
Any questions or comments from any of the legislators? Questions or comments? Anyone from the public? Questions or comments on that? No?
Yes, we'll pull clear. Thank you.
Thank you. Thank you for what you do.
Thank you. Thank you, everyone.
Thank you. Okay, moving on to number 6. This is an easy one. This is an easy one. This is approved for budgetary amendment. Department of Social Services. This is state aid pass-through to provider agencies. So if you just want to touch on that.
So this is the pass-through money to our provider agencies, two in particular, and our correctional facility. It's the most recent state aid authorization from OASIS dated June 10, 25. The increases are directly related to the targeted inflationary increase and the newly implemented funding related to the purchase of FDA-approved formulations of medications used to treat county jail inmates with opioid use disorder, beginning in July 1st, 2025. I'm sorry, I just put something on it. It's $5,010, valid from July 1st to the end of the year.
Okay, I'm glad to see
Pass
that.
it through.
Yeah, it's a pass, right, this is just, but I'm glad to see that they are administering that. Okay, Sherry, is there anybody from the committee have any questions or comments? Any of the legislators?
I see a bunch of different things on here. Is treated for hepatitis C also on here in use in jail?
For this specific funding,
Yeah,
it's not identified for that, no.
Okay. Because it's sometimes contracted for different
Anyone
reasons.
else? Any other legislation? Anybody from the public have any questions or comments on this? Okay. Very good, thank you. Oh, make a motion to approve?
Second.
All in favor?
Aye.
Moving on to number 7 is the approval for budgetary transfer from the Health Department, the Early Learning Center revenue. This is a bookkeeping, basically, entry here. We're moving revenue of $78,540. Would you like to update us on that?
Great. So, good evening again. I'd actually like to start by thanking Legislator Sage and Atanasio for making themselves available directly after this week's natural occurrence, as well as the entire legislative body for their continued support of the Early Learning Center. This past Monday's storm produced conditions that sadly caused significant damage to the construction site at Community-Based Services. Thankfully, the construction site was vacant, no one was injured, and the Early Learning Center interim space was unaffected. In response to the circumstance, CBS has acted expeditiously to remedy the situation. They had a thorough review performed by their architect, engineer, and damage response personnel. They've already hired a contractor to assist with cleanup, and electric and HVAC systems are operational in anticipation of regular activities resuming next week. In addition, the county requested an independent structural review by county-designated structural engineers to ensure the safety and viability of moving forward with the interim space as planned. The preliminary findings from the county-directed engineers have deemed the two-story structure seems to be structurally isolated. CBS has assured Putnam County they remain committed to moving forward with opening the Early Learning Center at their location. With this body's budgetary approval, we intend on moving forward with the plan to outfit the existing InterArts building for this upcoming fall semester, which will get the program started. Our team will continue to assess the condition on the ground and work with CBS, its engineers, to ensure the program's long-term success. So tonight I'd like to focus on our efforts for a formal approval of the Early Learning Center fund transfer so that we continue to meet the immediate timeliness associated with launching the program by September, as well, obviously, as well as address any questions or concerns from the legislators or Putnam community at large. So I wanted to make sure before we got into the fiscal fund transfer that we were available to answer any questions or concerns that anybody might have.
So, you said you had an engineer and an architect visit the property. Now, they're going to have to rebuild the building, correct? It's completely destroyed?
Correct. So,
and how will they move forward? How will they build it?
So they are in the process of talking to their adjusters so that their insurance would cover the cost of rebuilding the shell that we were going to basically build out for the long-term space.
And how will the shell be built? That's my question. Is it going to be the same structure as it was?
It is going to be a better structure. It is going to be new. It is going to be reinforced. It is going to be safer. Obviously, what we were proposing was in basically a vanilla box shell that was attached but predominantly a separate structure. So the expectation is they would rebuild a new structure, and obviously it wouldn't have some of the issues associated with trying to retrofit an older building. So this allows us to kind of do everything from the foundation up. It doesn't come at any additional cost to us, or to the county, I should say. This is something that would be covered by CBS's insurance. So ultimately, our expectation is we would take over basically at the same point at which they delivered an actual space.
I guess my question is, how was that structured? How was that building? It wasn't stick built. It was how was that? It was metal. It was a metal shell. Because I was in there.
Right.
So my question is, how will they move forward and how will it be built?
So my understanding is The current plan is to remove what's currently there. And basically, the slab seems to be still, functional, stable enough that then they would just, replace, as you indicated, with a new, shell. Obviously, this one would be newer. It would be fitted to our needs as opposed to us trying to retrofit an older building. And it would be structurally safe and sound for not only our children, but any staff, obviously, that we want.
I would hope so.
Yeah.
Yes.
Getting into a little bit of detail, because obviously, I run physical services, and I see we have one of the gentlemen from DPW here, okay? The existing building failed, okay? It was built to code, but it failed. So God forbid, if we would have had children in here, we'd have been serious issues. If insurance is going to pay for it, the odds are insurance is going to replace exactly what was there. So if this was an aluminum building, we're just kicking the can down the road. So I have some serious concerns. Is this going to be a brick building? Have we identified what failed? Was this flood damage? Was this damage because of rains and the structure couldn't hold it? Did a fire take place because an ancillary piece of equipment? I mean, I'd rather go someplace else that's safe and take a risk. And what is most disturbing to me is no one is saying anything about what happens if they don't get it done in time. I also see some people in the room who are in the trades. Normally when you build something and time is of the essence, there's something called liquidated damages. So what I want to know is if CBS can't get it done, so we can't move in the anticipated December time, what remedies are available to the county?
Sure. So I'll sort of work that question backwards. So we've already been in preliminary discussion with CBS in regards to extending the time in the interim space. That space was unaffected.
But that's for 12 students, this big space is
No, that's for 40 students.
12 hours.
12, right. So, which is approximately half of what we would have been utilizing the larger space for. This also gives us an opportunity to sort of ramp up as well as we increase the student body. So in regards to having a space and the additional time associated with now not just a build out, but actually replacing that facility would be extended. You are correct about that, but they are being a very
Brianne, I'm
good
going to be a pain in
collaborative
the ass
partner.
here. You guys sold us that you wanted to go to this space for numerous reasons. One of the critical reasons was that we could get more kids into school by December. Hearing you now, we're not going to have that ability to have these children in December. We're going to elongate it. Those are your exact words. So we're going to go longer. I got a big problem with that.
So I would respectfully say that we will have space available in September, right? So we've not even...
That's the contingency. I'm talking about the build-out which was destroyed.
So the interim space holds up to 40 students. So that gives us the ability to sort of ramp up and make sure that we have at least that. Now, the prior plan was that once the new year came around, we would open up the facility to additional students and families. The reality is, very few families would be moving their children sort of mid-academic year there. So we weren't expecting a huge influx of students coming in for the new year. And please, Valerie, if I'm,
Yeah, we would have trickling of children, but it wouldn't be like another 40 as of January. Because the annual reviews for school districts happen between April and May. So as they're doing it, we would get trickled in, so we would max out to 40. That was our hope with this extension now. And then hopefully take over in the new building.
So that, this certainly allows us that ability to ramp up. And in regards to what we end up structurally, obviously we can do this in a way that keeps us a lot more involved in terms of how that, structure presents, what's needed there. We're not retrofitting stuff. And once again, this was a shell. right? So it didn't have all the reinforcement of, actual walls that were put up. And we will get a report from the engineers around what actually failed. I'm not sort of a construction expert, so that is
Yeah.
certainly not my
And we
forte.
could,
but-
John Tully's here too, but they also said they were gonna repeat that. They were gonna redo the roof anyway, so that was probably the issue, so.
So it was a roof failure.
I don't know. We're
That-
waiting for
that's
the
what it
insurance and the
appears,
structural
right?
engineer's report. But if that was part of it, then they were gonna replace that anyway. We will know that report, and as soon as we get that information, we will share it with you.
But the building collapsed, basically. It's like. I took
Not
pictures.
fully.
Yeah. Any other questions or comments from the committee before I go on to the other legislators?
Thank you. So the pictures that I saw, it was the roof issue one, and there was also an area that was all brick. Am I correct?
Correct.
So it wasn't an aluminum shell. So in the flooding that we saw 2 years ago, that FEMA was currently involved in with municipalities and things like that, a lot of those issues that were caused were because of construction. Water coming down very quickly and having to find new pathways, trees being cleared, many different reasons that caused a lot of damage to happen. In this particular storm, I don't think anybody anticipated 5 inches of water coming down in an hour that can destroy. I have the pictures, a brick cinder block building that it just collapsed. Now, we have another building in the county also that has been under scrutiny with a roof that is deteriorating by the moment. I mean, this is cinder blocks that came down. It's not a shell, it's not aluminum. So I don't think it's fair to say that this wasn't a structurally sound building. I think if we have an architect go out there, I'm not an architect by any stretch of the imagination, but to take down cinder blocks and bricks takes some serious force. That's not happening just because of a failure. There's some serious force and some serious issues that we have created too, with not creating water paths, not clearing out easements, not vacuuming out different things that we've, I hope, learned from during floodings last year and continue to learn from. Because this was something that we need to continue to move on. I don't know what the next steps are for this. I support the Early Learning Center. I have been a cheerleader and a champion for this since day one, but I don't think that anybody could have predicted this storm to happen and the water to swell and cause this dramatic, incident and said that it's just a building failure. I think there's more to it. I think it's environmental, and I think it's a lot to do with the things that we've created over the past years and the changing of pathways and natural environments to create such damage.
So you're saying it was a brick building. It wasn't a brick building.
So the picture right here
I was in the building, and it's not brick.
So it is,
Cinder blocks.
it's cinder blocks. Yes, it's cinder,
Yeah,
it's
not,
giant
but-
cinder blocks.
But it is aluminum. It's an aluminum.
So the part that's
inside.
tumbled, correct me if I'm wrong, which the picture I have, is cinder block, correct?
The facades that came down is
Was cinder block. It wasn't an aluminum shell, it was cinder blocks. Cinder blocks weigh how much each? That are then, put together, they're put together and they've been, how long has this building been there? How many years?
Really long.
Okay,
That's where you
so
see
what my
the-
point is that it didn't just fall down. There was a influx of rain and other
of
aspects
course.
that came in and took this building down. It wasn't shoddy carpentry or a shell that was put up. And yes, we are thankful that we didn't have kids in there. But I don't see that InterArts, gets into a project that isn't anything but stellar. Everything they do is by the book, if not above and beyond. And I wouldn't want to see it go to anyone else, because these kids deserve a place like that to go to and continue their lives, to move on to the other projects that they have and the other different programs that they are afforded to. And I'm sorry, I just don't buy the shoddy carpentry and it's an aluminum shell, because it was several cinder blocks that fell.
Legislator Jonke?
Yeah. This was not a structurally sound building. I went up there. Cinder block wall just caved in. Okay, thank God the kids weren't there. I've made, it's not a secret that I was never a fan of going to this building. We want to invest millions of dollars into this tin can of a building for a 5-year lease. That's what was on the table, and we got kind of pushed into it, you know, and I know it wasn't you folks, but we had people coming in, we had parents coming in, and I was at one point in time one of those parents who desired to have my kid not travel an hour each way, and our heartstrings were pulled at. This was never the best option, and now how much longer are we going to have to wait to get these? Or we don't even know. It's probably too soon to even tell.
It's way too soon. As
Right.
soon as we know information, we'll share.
Right, and it's a 5-year lease. I still think we should explore, if we haven't signed the lease, we should explore other options. This building, it wasn't structurally sound. We probably never would have sent an engineer in there to look at it. We probably would have just gone ahead with the construction, millions of dollars worth of taxpayer money going into something that already exists, and for whatever reason, we're not going down the road, but there's another school right down the road, and by the way, they've offered, if you don't know, they've offered on a temporary basis, if the county wanted to use their space, they would be open to allowing the kids in there. And if the priority were the kids, we'd be looking for another space.
Thank you. Legislature.
Well, first of all, I don't think there's one person that's on this legislature who's against the Early Learning Center. We are all on board. This is something we've been talking about for years. But I think our focus is doing the best for our children, and I know that's yours as well, and also the taxpayer. You know, spending our taxpayer dollars in a wise manner. There are a few notes I made. We do have a wait list. Supposedly we had a wait list. We have our contingency space set up for September, and then we have a wait list that we said we would be moving into when the new facility is complete. Is that correct? We still have a wait list?
We have some.
Like there's a demand for this, and so we had to move
there's a
swiftly
demand for
to get in.
services, yes.
So we, I mean, as Legislator Jonke said, we did feel a little boxed in to get this done, so we could get the wait list filled for December. Did we or did we not have an architect look at this? Because I thought I saw plans when we went on the tour. And does an architect not look into the safety and the structure of the facility? Were we just sold this pretty plan sitting on a table? Or did somebody actually look at the building?
So yes, we did. Well, not we. CBS had an architect look at the building. The town Department of Buildings went in as well. We had, fire come in as well. We were actually supposed to be having the state come in tomorrow, which we've had to postpone. So there were several reviews of the facility. All sort of deemed the facility as sound at the time, but there were even initial discussions when the bid was being put out that the roof was going to have to be addressed. So that was going to be part of sort of the build out because of the fact that CBS was putting a new HVAC system on the roof. So there was already sort of a discussion around how to then be able to reinforce that so it could handle the weight of the new HVAC. Yes, I would say there were several reviews that occurred, and then subsequent to that, we've also have at this point sent in our own structural engineers.
Through the chair, if I can continue with my notes. We also understand that the construction, the build out of the facility is going to be done by the renter. The people who we're paying the lease to are going to be building out this facility, so how could we possibly be be assured that this is going to be a safe for our children? I mean, if it's being constructed by the rentor, I mean, how are we going to ensure that our children are safe in it? I just assumed that this was ready to be, it was a vanilla box and we're going to build it out and everything's going to be fine, and all of a sudden we find that the building fell down and they're going to be doing the construction. So I want to be assured that my children, grandchildren for me, but are safe in a facility like this.
Sure. So I would say that we're still going to need to have a review done by the town for a certificate of occupancy. So that's still going to require a review. CBS has been a very good collaborative partner thus far, and I don't see why they would stop doing that. They've allowed us to sort of bring in our own engineers to kind of take a look at what was going on, and I'm sure they would be collaborative in that process moving forward as well. So we can not only be reassured by their staff and people, we can subsequently actually ask some of ours to do a review as well.
Can I just one more question? How it, and this is probably preliminary, but how will this affect our investment now? I could just see it happening. Oh, well, we got to spend this much more because of this, then we got to spend this much more because of this, and then we got to spend it. Everything is going to topple. And pretty soon, $1 million facility investment, that's all it's going to be. It's going to be double, triple that amount, and that's what I see getting out of hand for the 11 kids that we were supposed to transport. We're going to save $1 million. Well, all of a sudden, it's costing us $2 million to save $1 million, and it's getting out of hand, as far as I'm concerned. I really would like to see the payoff, and not to have these kids travel all over the place, and not to have, us spend $1 million in transportation. I just. I'm losing some of my.
And
I want to be assured that we're not throwing money down a rabbit hole.
I completely get it. It is still the landlord's responsibility to deliver that facility in good standing. Our costs would remain relatively the same. Obviously, the caveats are we don't control sort of material costs.
Relatively or the same? Because you went from 1.5 million to 2.2 million when we approved the lease. So that's a very dangerous statement. Sorry, Chairman, I heard that.
So even in the statement we provided, the caveat was we don't control material costs, for example, right? So we've made certain assumptions based on current costs. Right? The additional, the 1.5 to the 200,000 was sort of explained as sort of outside of those direct build-out costs. So those were ancillary costs associated with the architect, the engineer, those additional costs. That's what sort of brought that up. But
it was the interest also.
And the interest on the loan.
That was the main gist.
That was the main thing, exactly.
So, what we can do, I completely understand our need to be, good stewards of the taxpayer dollars here. So, I don't want to sell you a set of goods here that aren't going to be in everyone's best interest, especially, the children and their families. That being said, there should be no, I'm not going to say no additional costs, but the reality is it is not our financial fiduciary responsibility to recreate what was there. We get involved at the point at which the landlord delivers a new facility. There may be some structural costs that we can save on. We're not retrofitting a building, right? We're not now trying to put ductwork around pre-existing sprinkler systems, right? We're not doing other things that now we can perhaps do better because we're building from the ground up, So I do think there's some opportunities here to make sure that, we are in line with what we put out in terms of estimated budgetary costs.
And what time frame would that be? Now that we have to build a whole new facility. So would we going another 6 months further, or?
We honestly don't know yet.
Yeah.
As the information is coming, right now the insurance adjuster's there, so they're working as fast as they can, but they will be keeping us up to date every week. We have weekly meetings. We could share that with you guys just so you have a sense of what, but we don't really have that exact information.
No, it's too soon.
It is way too soon, yeah.
I do think all of these questions are very important, and sharing the information is important. And so perhaps if you could let us know the best pathway to do that as we get information for you, if it's coming to physical services, if it's some other manner to let us know that.
You can send it right to the legislature.
So if as we get information, it definitely will be shared. It's so early on that I think there's a lot of more questions than there are answers. I did just want to make sure that, because I think there was a misunderstanding in one of the questions, just so that the public is aware, if Valerie clarified, the wait list is not for the Early Learning Center. So any parent who has a child who is chosen the Early Learning Center as their preschool location for September, they've already been admitted into that program. They will be attending the Early Learning Center. There's no wait list for that. There's actually spots open for it, and there's still room for it to grow in the space that it's in. So anything I might have said, I misspoke, but I do, in case any parents are listening, I don't want people to think there's a wait list for that.
the center base.
You know, based on what Legislator Crowley had, the first thing that comes to mind is the floodplain. So maybe we're in the 50 or 100-year floodplain. And that would mean that, hey, once every 50 years or once every 100 years, this type of activity is going, this type of storm and water activity is going to take place. And it did. There's a safety issue here, folks. You came to us and you said, excuse me, you came to a physical and came to the legislature and you said, time is of the essence, time is of the essence. All of a sudden now, time is no longer of the essence. I'll be damned if I'm gonna vote for anything that puts any kid's safety at risk. I'm not happy about this, but I'm glad it happened before we got in there. So now they're gonna increase the strength of the roof. Yes, we always knew they were gonna put a new heating, ventilating, air conditioning unit up there, but they should have known with all this architectural and engineer review that they had to shore up the roof. And if I may, I got a question for Conrad here. Conrad, if a lease was signed or not, wouldn't this be covered under force majeure and allow us to break the lease?
Well, unfortunately, to the chair, I don't handle our contracts works. It does sound like it could be applicable, so if this is a law question, moves forward, it's the law department.
The attorneys are already in meetings, so they've already had preliminary discussions, so I think that's information that we'll have to share with you as we get information. But
Because
attorneys,
for me, it's all about safety. And
I
if
think
now
for-
it's not a rush,
Yes.
let's
And
get it
well-
right and let's make it safe. Whether that means staying here or moving, that is not as important to me as being safe. Because right now, what you're telling me, what I'm hearing, environmental impacts, a roof caving in, and we don't know what other things, and I have not seen pictures. I want to make sure that people are safe. And right now, you cannot assure that to me.
well, I want to be clear that we are talking about two different spaces. So
Yes.
the push was to get a school open in September. And
Yeah, but
that
I don't see
school-
that as a problem. I'm talking about the
I know,
buildings.
but for other people who may not know as much as you do about the situation, I want to make clear that people do understand the school opening in September is in a separate building. And that was the urgency to get a school open in September. And so that is still going according to plan. And the reason we requested to be on tonight before this storm, and before this disaster hit, was to get supplies and furniture and equipment that are needed for that space in September, which is still very time sensitive. So I just, in case other people didn't know the difference between the two
Right, they're
things that we're
discussing
talking about.
two different,
Right, yeah, two different buildings.
yes.
Thank you. So I just had a couple things. Again, these are two separate buildings. It's sad that this happened. But again, we're going back to 2 years ago with all the flooding, houses that were built and destruction and mass chaos that people had to figure out on their own. And you can't tell me all those houses were structurally unsound because of an environmental impact of a rainstorm. Are you telling me all the cars that were underwater on the sawmill on the Bronx River Parkway, it was the manufacturer's fault when they were flooded and it was their fault? It just doesn't make any sense to me. This building was up for years and years. It received many grants from the state for programs that are currently there, correct? And you have to have a certain compliance in safety in order to receive them. Am I correct in that?
Correct, quarterly inspection.
So respectfully, and they have buildings all over the place, and they have gotten grants, that they're a non-for-profit. How many spaces do they have? 20-something? 18 spaces. So they've been pretty good at making sure and taking care that our children and our population that needs extra care and extra love is protected. This was something that was unpredicted, and I don't think we can blame anybody but the weather. I'm sorry. It was a lot of rain. Thank God nobody was there. Insurance will cover rebuilding the building, and then it might even help us out financially in the end, where we will be able to build exactly what we want and save us some money. But I don't understand how we can say, without having an architect there, and maybe somebody who was more familiar with east of the Hudson, and watching the water flow and all of that good stuff, and the amount of water that rose, and how fast it came in, and the nice egg poles that were shooting through people's houses, and all the other things that happened. I don't know how we can predict that. We can't. It's not something that somebody is going to expect. So If we had to replace the roof, that's fine, but the caving in of the building was not something that we expected. It has been looked at by the state, it was gonna be inspected by the state again. It's been proven to be sound, the town looked at it, so are we holding all of these people culpable for saying that this building was safe when it wasn't?
If I may. Thank you.
Yes,
I'm gonna probably repeat what we're doing here, just so I make sure I understand it. The fund transfer we're asking for on number 8 is for the school that's going to open in September.
We're on number 7 right now.
Oh.
We're still on 7. Yeah, but it is.
Yeah, we're still on the discussion.
Yeah.
Which is
We're still on
fine,
7.
and I guess I have some questions about, this
We'll get to that,
discussion.
we'll get to that.
And we've come this far. I don't know where I stand on this, so I have a lot of sorting out to do. My impression is that when something like this happens, that there was a building code that existed when this building was built, and it wasn't the same code that we have now, I would imagine. Hopefully our code's better. I mean, I guess because it is a public building, they would have to have complied and changed things up on the building to comply with the existing code. I mean, but I think what you're telling me is that they're gonna build it back, and they're gonna build it back better. Is it in a flood zone? Those things are so easily found out. Those maps are on any town website. We can find that out right now if we want. You know, my opinion, flood zone, whether you're in or not, is out the window right now, because it doesn't matter if you're in a flood zone. You're gonna flood no matter what. We're in climate crisis, so everybody's gonna flood soon. So my hope is to move forward. My hope is to build it back stronger and better, and I believe that's what happens in situations like this, and hopefully it can happen, I don't know, hopefully it can happen like Governor Shapiro did in Pennsylvania when he built that bridge in 12 days, and we can just do that, and we can build a really strong, sound, not we, and like, my landlord has to replace my roof and clean my basement when it floods, and I'm not required to do any of that, and we're not gonna require the taxpayers to fund anything in the repairs of this building. We're gonna ask the taxpayers to fund what we need to outfit an early learning center, and that's what we're doing tonight.
Thank you. Anyone else?
May I just add?
Oh, sure.
One piece, just to give you some reassurance about the cost.
Yes.
The bid for the intended space was out, and those were due back. They did put a pause on that. The good news is that set the parameters for what the county was going to expend. The bid has been paused temporarily, and addendum will follow after everyone's done during their review. But we will have the basis for what the original bid is. If there's anything that needs to be added to the bid as a result of what happened earlier this week, those changes will be made to the bids, and they will have line items that we will be able to absorb. So I don't think that the county will pay any more than what we would have paid had this unfortunate event not happened. That's why we have a metric, we have a way to determine how it would work and keep the cost the same. That was it. If there's any other questions with respect to that piece of it, I'm happy to answer.
Thank you. Anyone for, oh, I'm sorry.
To the law department, was when we executed the lease for the contingency space, did that also obligate us to the build-out space?
Again, through the chair,
If you could please get back to us as soon as possible to the whole legislature, it'd be appreciated.
Anyone from the public have any comments? Please come up to the podium, state your name.
How's it going? Greg Harris, Carmel Hamlet. Just give me a sec to use my favorite purple pen. I apologize for my appearance tonight. As you guys know, I typically come here from work where I do fitness training for individuals with special needs who may make use of a facility like this. So unfortunately tonight kind of reminded me of where we were about a month ago, which I think then I used the word frustrating, so I'm going to use that word again tonight. This is a bit of a frustrating conversation. I think it's frustrating for everybody, right? What's challenging is, at that past meeting, and Legislator Jonke's right to bring this up, is that we had a lot of parents here who have children with special needs. You heard directly from them their anxieties and their fears, right? And I think you all recognize, I know you all recognize, that those fears and anxieties are only heightened when something like this hits the news cycle. When they look at the pictures that we were just talking about, they see that cinder block and aluminum collided wall. It scares them, and it should. And if they listen to this discussion tonight, they probably didn't get a lot of clarity. And the health department staff, I commend the work that you do, and I heard you guys loud and clear. It's too early to have a lot of these answers. What I would like to hear, what I'd like to see, is that not only does the legislature get information in a timely and transparent fashion, I hope that happens on a more than just semi-regular basis. I hope you guys are given as much information as possible, as fast as possible. And that I hope that in turn comes to the public. Because there are families who are relying on this. They are in desperate need of this. You saw how much this means to them. They can't just wait and hope that this happens. Their bandwidth doesn't allow for that. They're in a perpetual state of anxiety already. So what I would just ask is, I would ask the administration and I would ask the legislature to push whatever dysfunction exists aside and make sure that all the information that comes to this legislature, and that I hope it comes to this legislature, and I ask you guys to make sure that it does, demand the information that you need, and then let's work together to make sure it gets to the public, because these families need it and they need it yesterday. So, thank you.
Thank you. Anyone else? Okay. I make a motion to approve budgetary transfer 25T190, the Early Learning Center revenue. Do I have a second?
Second.
All in favor?
Aye.
Aye. Moving on to number 8. Now we're going to talk Legislator Montgomery. We're going to talk about the purchase items necessary to initiate the startup of the Early Learning Center. And this is the contingent space, so everybody's aware of that. So I see we have a list here of $270,250. Is there anything you want to speak of on this?
No, this is all the requirements that the group of us worked out that is required to get it going in that space, in the interim space.
Yes. Okay. Pretty straightforward. Anyone else have, anyone have any, firstly, do you have a comment? Do you have any comment?
I just want to ask if any of this can be moved over to the new space?
Any of the stuff we're purchasing? Oh,
Yes.
That's the whole idea.
Yeah, I just want that on the record.
Yeah.
Thank you.
Legislator Page.
So I see most of this is coming out of preschool itinerant services.
Yep.
That's just a budget line that was just vacated because we're building a new facility, or
That line's going to decrease, is why we're taking it out of there, because we're saving that difference between $50,000 and $30,000, or $20,000 per person. So it's like I said, this is going to be a savings, and the savings are coming from the pre-K lines and pushing over here.
so we're not gonna, I mean, budget season is upon us.
Yeah.
And so this itinerant services for preschool is gonna be lower next year, is that correct?
Yes.
Okay, so this is where our savings is coming from?
Yes.
Okay.
Yes, and the lease transportation also.
This $1,000, no, 50, maybe $51,000?
This is just like I said, the startup to get us going. Everything else will happen.
Okay, so it's based on savings, so that's good.
Anyone else? Anyone from the public? Questions or comments on this item? No? Okay. Make a motion to approve the fund transfer, 25T191. Do I have a second? Second. All in favor?
Aye.
Aye.
Thank you. Thank you for explaining this evening. Hang in there, yes. Move on to number 9, other business. Seeing there's no other business, make a motion to adjourn. Do I have a second? Second. All in favor?
Aye.
Just 6 months. You can't do that.
Good evening, everybody. Welcome to the Physical Services meeting. Please join us, Legislator Crowell. Will you be so kind as to lead us in the Pledge of Allegiance?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Will the clerk please call the roll?
Legislator Crowley.
Present.
Legislator Jonke.
Present.
Chairman Ellner.
Here. Agenda item 4 is approval of budgetary transfer for
What
Department...
about 3?
Oh, I'm sorry. I'm trying to move fast, folks. My apologies.
Thank you.
Okay. Move to accept the minutes of the previous May 19th meeting. Do I have a second?
Second.
All those in favor?
Aye.
Agenda item 4 is approval of budgetary transfer for DPW. We're going to purchase a Tomahawk 8-inch road planer asphalt grinder.
It's a fancy description for
Yes.
a portable milling machine.
For a portable
large
milling
rate
machine
areas.
for about
Yes.
$2,500.
Yes, exactly. So that did not eclipse the capital threshold of $5,000, so we transferred capital funding into operating to pay for this item. So
Any questions of the
pretty
committee?
straightforward.
Fellow legislators? Public? With being none, I move that we approve this transfer. Do I have a second?
Second.
All those in favor?
Aye.
Okay. Thank you. Agenda item 5, is we're looking at a budget transfer for additional cameras to be put into our, I guess, our bus fleet. I see Commissioner Tully is here. Thank you for coming. Commissioner, a couple of questions. Will we be replacing any cameras, or are these all new and additional cameras?
So if I could, the camera feature will be new, but the telematics feature is not new to the system. The Director Lannon worked closely with Commissioner of Finance Lewis to assure that this feature was in the previous radio system, even in the DPW trucks. In a lot of the OSR, DPW, and planning fleet for logistics management. This is a new system because...
Geolocating, so we know where all the vehicles are.
Exactly, yes.
Okay.
It's not used for discipline.
That was my next question, have the unions been advised? Have the unions been advised? Are the unions okay with this? Are they aware of it?
Paul Eldridge is working on that as we speak. But that's what Paul indicated to us, that we could move forward with this as long as it wasn't being used for discipline purposes. We feel that it's advantageous to the employees, quite frankly. It would show evidence of speed, accidents, and help support claims that they made. But in fact, the unfortunate incident that happened with I think it was the Youth Bureau, right? That there was some video evidence. It wasn't from our vehicle, but it did help prove fault in that case. And Director Bruno has also indicated that there could be potential savings in our insurance premium by going in this direction.
And just scanning through this, what's the term of the lease?
I believe it's a 3 or 5 year lease. This is off of the U.S. government GSA contract. The vendor is it would be Verizon. So
Right, I'm just trying to say, is it $15,000 a year for the next years? Is the $15,000 for, if it's 3 years, then it's $5,000?
That amount will get us through the planning fleet for more than, for when we submitted that transfer, we were anticipating that it would cover at minimum the planning fleet through the end of the year. But once Commissioner of Finance and Director Lewis finalize the fund transfers for the other departments, we can phase in the other departments systematically.
Yes, Legislator Crowell's got the floor.
Thank you, Chairman. So this is just the lease. Then we also have to implement the system, right, that we're gonna use to monitor it. So what is that, the fee on that, and what is the
It's all-
terms on that?
It's all included, and installation is included.
That was my next question,
Yeah.
was installation
Yeah.
as well.
All included, yeah.
Okay. And who's gonna be monitoring this, or is it only monitored if there's an issue, and then secondary? I'll
So
let you
it's,
answer.
every department head, the intent is that every department head has their own access for their respective fleet, right? And there, obviously, there'd have to be an administrator that grants access to the respective departments' fleets, but we want the department heads to be able to maximize the information that's in there to make their best decisions in how they deal with their operational needs.
And how long do we have to keep this data on file? Because I know, like, with the school, we did the school bus, there was a separate procedure for how long we kept the data. The storage was a huge cost to us. So that also is something that's missing from this proposal.
I have
is
that
the
answer.
storage
I
and
just
how
don't-
long we have to keep it, who keeps it.
I owe you an answer on that one. I was given that answer, and if anything I say, I won't be, I don't
That's
remember
okay.
exactly what it was, but I do know that the video data isn't captured 100% of the time. It has to do with acceleration, quick braking, and things like that that triggers
The camera to come
the
on.
camera to
So
come
it's
on.
almost
So, yeah.
like the police department, kind of like it would go
Very
back
similar.
10 seconds if they hit a certain speed or
Exactly.
erratic braking, things like along that nature?
That's my understanding.
So, okay, so it would be
Yeah.
triggers and then we could find out how long it needs to be kept for, and that would be a policy that would be submitted to us?
Exactly.
And then we'll find out how much the storage is as well?
The storage is included.
That's
It's-
included
It's
too,
all,
okay.
it's all in the cloud, yeah.
Well, actually, there's 256 gigabyte SD cards, and they're very, very reasonable, a couple of bucks each.
Yeah.
And it appears that every one of those is gonna be in each vehicle, so that's gonna have a significant amount of video, and typically stuff like this, you'll set it up so that it may erase itself
I think it
after
formats.
30 or 45 days.
Just one more. Whose responsibility is it, sorry,
No question.
whose responsibility would it become then too, if we're putting it, it's not going to the cloud, it's going on a chip, right? The policy, so whose responsibility is it? Like, I know with the cameras, just talking with the police department, it's their responsibility to charge the cameras, load the cameras, and make sure all that goes. That's the deputy's responsibility. So is it the operator of the vehicle's responsibility to make sure that that card, after 30 days, is emptied out and ready to go for the next 30 days? Or software updates, or
Yeah,
plug it in, or do whatever, it's the operator that needs to do it?
It's programming. I think
Okay.
if we tell the system we want it to stay for 10 days, it'll stay for 10 days, and then it'll be wiped or formatted, but
Okay.
I'll owe you that answer
Recorded
as well.
over,
I will confirm that for you.
Legislator Sage, you have a question?
Well, I don't know if you have a question, the answer to this, but I'm wondering if that will affect our insurance rates? Maybe it might, I mean, if an employee knows they're being monitored and the safety of the fleet is.
Matt Bruno indicated that he did talk to the insurance company, and he did indicate that if we do roll this out, they would entertain some type of discount. They're not going to tell us what that is up front. I'll ask Matt if he has any more details on it, but he did indicate that there could be a credit on our insurance because of it.
Any other questions, comments from committee, legislator, public? Being that there's none, I move that we accept this and this fund transfer and go to the full. Do I have a
I
second?
think that's just a discussion for your,
Just a
it's gonna be a
discussion.
sign and audit.
Okay, so just do the, okay, so we move this forward to audit. Do I have a second?
Second.
All those in favor? Aye. Okay,
Thank you.
being that there's no other business,
Thank you.
I move to adjourn.
Okay.
All those in favor?
Aye.
Rules Committee. I'd ask everybody to please stand for the pledge. Greg, would you lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
I would ask the clerk to call the roll, please.
Legislator Ellner?
Here.
Legislator Gouldman?
Present.
Chairman Birmingham?
Here, thank you. We'll go to item 3, verbal report of the chairman. Just a brief overview of tonight's committee meeting. We've got some fund transfers or budgetary items under items 5 and 6. We have item 7, which is our favorite topic, the legislative manual, but hopefully this will be the last committee hearing for this, and we'll advance something to the full meeting in August. We always have our FYI, our litigation report. I would remind my colleagues that the litigation report is a confidential item, so after this meeting, please make sure it's shredded. And then under item number 9 and 10, we have other business and adjournment. Other business, as you've seen in the other committees, is simply those items which are brought forth by a legislator dealing with matters pertaining to the Rules Committee. So that's just a brief overview of our meeting tonight, and that's the end of item number 3. Item number 4, we have acceptance of minutes from the April 10th meeting. Any comments from my colleagues? Seeing none. Any comments from the public? Seeing none, that's item 4. Item 5, we have an approval, request for funding to Career Support Solutions, county contribution, taking it from Subcontingency. This is for approval. It's a request for funding. Greg, would you like to take this item and then maybe call up somebody?
Sure. Thank you, Chairman. Would Ms. Cornish-Lauria please join us at the microphone?
Good evening.
Good evening. Thank you. You are the Director for Career Support Solutions?
I am.
Okay. And please chime in. I know that you do wonderful work. You help people with disabilities, primarily mental disabilities, and you help to train them, and you also work with local businesses to find employment. So these people can be productive members of society, and also they can be as independent as possible.
Correct. We're a private nonprofit. We've worked in Putnam County for 35 years. We work with, on average, about 100 Putnam residents every year. They are intellectually and developmentally disabled, and they also may have psychiatric issues. We have several different programs. Our main program provides workforce readiness training and placement to people with disabilities. We work with students in all the schools. We teach classes to them. We set up paid internships. When they get into our adult program, we're again working with them on learning skills. We do their resumes. We set them up in jobs. We provide on-the-job training, and we provide long-term ongoing support leading right up until the retirement. I've been with the agency for 37 years, and some of my clients are still with me. So we've never really asked the county for money before. I have to fundraise about $340,000 every year at this point to meet our budget. About 2 years ago, I think I got $15,000 from the county. This year, $15,000. I've asked for $30,000. At 100 people on average that we're working with for $15,000, that means it's $150 per client. And we work with many of our clients every single day of the year. And all of our other clients we're working with could be, several times a week, every week. So $150 does, barely puts a dent in it. So I've asked for $30,000 instead of $15,000 to get me closer to meeting our budget.
Right, and thank you for being here tonight. And what I'd like to do, just as a procedural matter, you handed something to us tonight. I'd like to make a motion to accept this additional. Is there a second?
Second.
All in favor?
Aye.
Aye, thank you. Just a little history. This is part of a continuation, if you will, not only from a meeting we had a few months ago where you were kind enough to come and speak with us, but also from a continuation from last year's budget proceedings. I was not on the legislature at the time, but I understand that some of the contract agencies, I call them, they're also known as outside agencies, some of that money was placed into subcontingency for disbursement during this fiscal year that we're in now. And it's my understanding, the auditor's not here, but it's my understanding there's currently still left in that bucket, if you will, of contingency or sub-contingency, about $57,000. We are getting towards the end of the fiscal year here. We have two requests, yours and someone else on the agenda tonight, both of which combined do not exceed that $57,000. This resolution before us is a approval to request the county executive to initiate a budget transfer for $15,000 for this program. So just want to give a little background on that. The next item is similar but has a different mechanism of doing the same thing. So with that, I open it up to the committee for any questions or comments. Bill?
We, on October 29th, when we adopted the budget, we gave you $15,000, that's correct? But you requested $30,000. What are you gonna do with the additional $15,000?
Well, it's really not additional, because again, I have to fundraise about $340,000 to meet my budget. So it's not like I would be getting, you know, more, I have a hole that I have to fill. We have a lot of clients. We work throughout all of Putnam, Westchester, and Lower Dutchess, and we work with about 350 people a year. But again, this specifically is for Putnam County, where we work with about 100 on average. So most of the time, it's more than that. So this money would go to them.
Would it be fair to say that this $15,000 might free you up to do some programmatic work that otherwise you would be spending on fundraising?
Absolutely. Fundraising takes up, you know, an enormous amount of my time.
I'm sorry.
Could you wait until the next budget, which is 5 months from now?
Well, I suppose if I had to, sure. I mean, you know, as long as I know that it's coming, you know, in my budget, sure.
Have you, do you have any idea what you're gonna ask for next year? Last year you requested $30,000.
I've already asked for $30,000 for next year also.
Okay.
I've already submitted that, so.
Any other committee questions? If not, we'll go to Tony, then Aaron.
I just wanted to, you didn't mention a little shop on Route 52. Okay, can you just explain to the public?
Yeah, we also have a fundraising thrift shop that's just north of ShopRite. It's run exclusively by volunteers, and we also have clients who work there who learn skills that then we can take them from that internship and get them jobs in the community. So it benefits our program, but maybe even more so, it benefits the community, because we have, everything is donated. Volunteers' time is donated, and all of the stuff that we sell is donated. So we sell things very cheaply. We try to promote it throughout the county so low-income people can come in and get what they want or need. So it benefits both of us.
Aaron, then Paul.
I had spoken to Christine Cohn, who's the chair of the Bayback Carmel Chamber, and talking to her about businesses that are involved in the chamber that do hire and train and mentor people with disabilities, and was trying to get together to recognize with her a list of those places. Would that be something that would be helpful to you? I know you're trying to create long-term strategy and develop skills and things like that, but is that something that is at all a help to what you guys do?
I'm not really sure what you're asking me, to join the chamber? Is
No,
that
not
where-
you, no, I was working, she runs the chamber, but I had asked her a while back about a list of chamber members that did hire people with, you know, with developmental disabilities or different disabilities, and that do mentor, train, and coach kids and, or young adults or seniors or whatever, you know, people run across. Was that something that may help some of the people that you guys, that fall into your lap, as a resource?
Not really. I mean, we've been in Putnam, again, I grew up in Putnam, so I know a lot of the businesses, and my staff we have almost no turnover, so my staff have been around forever. We know all the businesses, but we don't have like a pool of businesses that then we fit our clients into. When a client comes to us, we do an intake, we figure out what they want and need, and go looking for it. So to have a pool of employers doesn't really work for us, and it's a lot of time and effort where we may not ever have anybody for that particular business. So it's better for us to go look for exactly what we want and need and then approach those businesses. Years ago, I used to be in all the chambers, and it was just a lot of time and being in meetings and where it didn't really serve the purpose.
I didn't mean a chamber exactly, it was just more
Oh,
so
I
like a
know.
list of businesses that, you know, were involved in, like I said, coach mentoring and educating whatever disability this person may have, and to try and get them to succeed and be whatever their level of, you know, success is in life. So
Right, I mean, that's what we do. We provide the job coaches to go in and work with the clients in all those businesses.
Thank you, Paul. And then we- Thank you. I think Legislator Gouldman asked some questions which probably should have a little refresher on what happened in last year's budget. All right, it was a disaster last year. The good people from these contract agencies spent their time down the hallway making a case for funding. Okay, an agency like yours and the one we'll talk about next are agencies that do work for the community that the county does not do. Okay, so you're filling a need in our county, and I'm grateful for your work and all the good work that these agencies do. They basically they wasted their time because they went down the hallway, were given big zeros, and then $75,000 came down in subcontingency for us to dole out. It was like having 10 lions and handed enough food to feed 5 of them. All right, and that's where we are today. And to ask if they should wait till next year's budget is truly unfair for any of these outside agencies. So I'm sorry for the way you were treated, and I'll support this all day long. Amy?
So, I think you have a wonderful not-for-profit. I'm very familiar with the not-for-profit space. My daughter used to work for the ARC. How is that different? Because that's exactly what she used to do. She would train people. She'd take them to Tops grocery store, show them how life skills, and try to get them in positions.
Well, there's
So what
a
is
lot
it
of
different that you guys
differences.
do?
You know, first of all, we don't do any residential, which ARC does a lot of residential. We are strictly vocational and pre-vocational. We also have a day hab program where we have clients that are out in the community who are lower functioning, who are not quite ready for work or even an internship. But everything that we do gets them to be more independent, to gain confidence, to gain self-esteem, to get into possibly an internship and then a paid job where then they're a part of the community and they're giving back. So we teach a lot through volunteerism throughout the county. We do recycling, we work with Second Chance Foods, and it gives our clients a self of worth, and they're doing a volunteer work for the community and learning skills that then we can get them jobs. I guess the biggest difference between us and any other agency is that, again, we've been around for 38 years. 37 I've been with the agency. We're still working with people 37 years. Other agencies do not do that. We are with the client until they don't need us anymore, until they don't want us anymore, until they retire. And that's the biggest difference. You can't place somebody and train somebody and then the disability doesn't go away just because you got to that step. They're going to have issues forever. Families, with them, with their employers, with their co-workers, and constantly reworking, you know, what they need to continue to be successful in a job and to feel good about themselves.
That's another question. If this additional funding doesn't come through, how did somebody ask this? How will you make up for this, or do you have other funding?
It just means that I'm just writing more grants and trying to do more fundraising.
Do fundraising, yeah.
And it means that the staff won't get maybe a raise or, you know, I mean, we had, it was only a couple of years ago that we went 8 years without our staff ever getting a raise. 8 years, they didn't get one raise. So, you know.
I just have one more question. So, I I mean, if this is not a contracted position, a contracted amount with the county, I mean, for me personally, I would like to see it funding programming and to actually have a visual on exactly what this is funding. Is this funding, you know, our, I don't know, internship program? Is this funding our, you know, like detailed instead of increases in,
Well, I can tell you that the funding goes to staff salaries. That's what it's going to pay for.
That's where I have a problem, is staff salaries. I mean, I understand that's what you should be fundraising for, but not coming to the taxpayer. You could go do, you know, your fundraising activities, your thrift store, but the taxpayer, which is our money that we have, comes out of everybody's pocket. I don't know that I'm willing to take money out of somebody else's salary. Go to some of these.
One
You're
thing,
not profit salary.
on that point, if I could, because one of the main reasons I call these agencies contract agencies and not outside agencies, or not even though you are, not for profits, is that we do have a specific contract with each one of these agencies. And to the extent that perhaps we'd like to see our, you know, the taxpayer money directed towards something else, I'm sure your budget is, from a dollar standpoint, rather fungible. And if there's something where, if you're spending I'm making these numbers up, if you're spending $100 on staff salaries, whereas the county $100 might want to be better, might be otherwise spent on some other thing that you're spending money on, I think that could just be a matter of drafting a contract to state that. Unfortunately, well, not unfortunately, but it's a reality that every organization runs on salaries. I mean, this government runs on people being paid. Certainly not-for-profits, the employees certainly aren't most times, although they're getting more hours and I'm sure they're getting paid. You know, they're not, they need to be paid as well. So if there's a way that if that is a concern, I'm sure there could be something worked out where the tax dollars might go to something that...
I'm just kind of confused.
I don't know, yeah.
As a taxpayer myself, I would not want my tax money to go to fundraising or to...
programming is what I'm saying.
But programming, what is programming? Programming is the staff providing the program. That's where the money goes to. I don't think you want to pay for rent or computers or a thrift shop or anything else. I would think you would want it to go to the programming. The programming is the staff who are working directly with those clients. It's just like a teacher's salary, right? You want the money to go towards a teacher's salary, not a building or the rent or, you know, an IT person or snowplows. You know, you want it to go towards what is running the program. So.
No, those are good
So
points.
specific to that.
I agree. First of all, we got Bill, then Greg, then Nancy, then I feel like the guy, remember Romper Room? And then Terry. So yeah, Bill, then Greg, then Nancy, then Amy.
I knew you worked with children and adults, but I didn't realize you had people in their 70s. Very impressive to have someone at 79 years old. That's very impressive.
We work from high school right on to retirement.
How many senior citizens do you have?
How many what? I'm sorry?
Seniors do you have?
Oh, I don't know off the top of my head. For Putnam, I'm not sure. Probably 20 from Putnam right now. You know, it's the smallest amount of clientele that we work with. But we offer the services and we work with, you know, the senior program with the county and, you know, other programs that work with seniors.
Greg, then Nancy, then Tony, then Eric.
No, quickly, we're spending millions of dollars for our early learning center, and these are the same individuals who, as they matriculate, that are going to benefit from this organization. So to me, an additional $15,000 for up to 100 or more people, this is a very, very good investment. It's a relatively small thing compared to the between $2.2 and $3 million that we're going to spend.
Nancy?
Can someone remind me what our unassigned fund balance is? $40 million in unassigned fund balance?
$99 million.
Yeah, 40 is something else. I'm trying to get my numbers. And I remember your presentation when you came before us during budget season. I didn't remember it when the request came last week, and I was like, wait, you know, why would we, And then, yes, now I recall very clearly because, yeah, I did this work and I never got a raise, and that's why I had to leave the work, and it's really unfortunate. And I think the idea about at least this money, the $75,000, or money for outside agencies, as I've talked to the county executive, is really to provide services that the county doesn't provide and can't, and I think you provide that service. And you know, I'm just thinking about those families who, I used to manage group homes, and I think about those families who don't have their adult children or children in group homes, and they're at home and they need your service desperately. I don't need to go on. I can go on and on. I'm in full support of this. My first reaction was, can we give some funding to those that didn't get it during the budget process? But there's still money in subcontingency. So hopefully there's still an opportunity for my colleagues to hear me out on some of those agencies that didn't get funded. But I'm more than happy to support this.
Thank you.
Tony Thinner.
I don't even have to go because what you said, and I was going to say.
Yeah, what you said.
About the outside agencies providing a service to Putnam County. And actually, we save money as a county by the services that you provide. Thank you for what you do.
Thank you.
Eric?
I think Legislator Russo.
Oh, I'm sorry. Laura.
This year I was covering.
I'm sorry. Laura?
I just want to say thank you at your presentation. I did say that I know some of your people involved, whether it's the volunteers in the store, which I do go to, donating and purchasing. And then I do know some of your clients, and you've done an amazing job. One of them I know was, you know, whatever, and then to see that person now is total transformation, and is a great person to talk to, and I owe that to you because it's made a huge change in their life. So I do support your organization in many ways. So again, thank you.
Great, thank you.
I apologize for missing your hand, Laura. Sorry about that.
That's okay.
Eric?
That's
Okay.
Eric. Maybe, I know that during the budget process last year, we didn't get a lot of the information from the outside agencies that were presented to the executive's office. Perhaps maybe just understanding, this body to understand a little bit more, like how many people you employ, what kind of services you provide, even just through an email or something might be also good to have on hand, just also for a community resource as well.
Sure, I mean, I kind of gave you a condensed version.
Right.
But I can certainly, I mean.
Like if there's 6 people and you have somebody that specializes with physical therapy or emotion, you know, AV therapy or something like that, I think it's good to know, you know, and it really kind of sets your program apart because you also help with other issues that people may have with also having a job too. You know, you're providing other services aside from just teaching them skills, you're also providing services on how to cope with those skills and deal with a job that might be brand new and things like that. So just understanding kind of your pyramid of how everything works might be a good resource to have a little bit.
Sure, I think I've sent out information to all of you in the past because I presented before, but I can certainly send a wider scope of what we do.
I'm in support. I just think it's great to know and understand, and also too, it's a resource to the community. You know, it's out, you know, for the public to understand. Like, hey, you know, does my family member fit this program? Would it be something that helps? You don't really know exactly, you know, what they provide. So I think it's great to the more you know.
Sure.
Thank you.
Any other legislator wishing to speak? Any member of the public wishing to speak? Hearing none, I'll make a motion that we pre-file this for the August meeting. Is there a second?
Second.
All in favor?
Aye.
Aye. Thank you. Thank you so much.
Thank you
Again,
very
thank you
much.
for coming by. Okay, item number 6. This is a budgetary transfer in the amount of $10,000. It's for the PRPH program. Although you're not a member of the committee, Paul, I know this is something that you would want to put forth. Would you mind walking us through?
Yes, thank you. I put this request in, this was last week, and the executive director, Jim Sullivan, is traveling in Europe, and I'm not sure if he's back yet, but I thought I could just give a synopsis. Jim was here a few years ago to present on what PRPH does. I'm familiar with their agency. They do physical habilitation for special needs children and adults. It's not just bowling, it's not just, you know, a basketball clinic that they have. They also do brain stimulation. Dr. Gorman down in Mayapack has an interesting facility, and PRPH brings their clients down to Dr. Gorman's office. So it's a great agency. They provide a service that's not provided by the county. I couldn't tell you how many people take advantage of it, but it's a significant population that benefits from their good work. They put in for additional, I think they put in for $15,000 more last year. I asked for 10 now. We do have that subcontingency account. Legislator Montgomery talked about the unassigned fund balance, but this is money that's been designated. So, and I'm just asking for them to get really what they should be getting for the service that they provide.
Any comments or questions from the committee? Any legislature? Oh,
Bill.
sorry, Bill. Go ahead.
Do you know offhand, did we give them money last year or this year earlier?
We did. We gave them, I think we gave them 10,000.
Any,
I just have a question about this. Do they also have a contract line in the health budget? I think they are also contracted out in the health budget.
I think they have something to do with the Youth Bureau.
Maybe the
It might be the Youth Bureau.
Just curious. And just to be clear, we do have $80,000. We had an $80,000 ask that wasn't funded. I'm just looking at our outside agencies that weren't funded. The amounts that they did not receive was $80,000. And that doesn't include the Garrison Arts Center, which was $9,800. They received no funding. Boscobel asked for $15,000, which received no funding. And the Hudson Valley Shakespeare Festival, which is outrageous in my mind, but they did not receive funding anyway. But they asked for.
It's not outrageous when you
Well,
think about the sales tax revenue
they
send back to us.
Asked for $85,700. So
there were no guidelines. I'm sorry, through the chair. There were no guidelines as to what anyone could ask for.
Yeah, I'm just trying to point out that we had an ask that was not. We have a lot of agencies that asked that didn't receive, and tonight we've heard from 2. So I just want to make that clear.
No, that's a fair point on both points. I think we're just doing the best we can at this point. We're already halfway through the year, and to the extent and this is just 1 out of 9, but to the extent we can have some of this put to good use before in this fiscal year, and then we'll start with a blank slate for the 26 budget. But I don't know, it's just my 2 cents. Any other legislator have any comments? Nancy?
Just a comment, I did bring up the fund balance, and a reason for that is to go back to, again, a lot of this contingency, sub-contingency funding is for services that we can't otherwise provide. We have a lot of vacancies in our employee roster, and we're not providing, or have a hard time providing services sometimes, and this is another organization that provides services that is desperately needed for this population, for their families, and I'm in full support of it.
Greg?
2 things. One, I just wanted to amplify what Legislator Montgomery said, that because of the vacancies, some preliminary estimates were that we were going to add between $8 and $12 million to the fund balance, so it may actually be exceeding 100. And the other thing is, being that there's no public comment, I wanted to make a motion that
Well, we don't know if there's public comment yet.
I'm sorry?
Yeah. Any other legislator have any comment on this item? Any member of the public have any comment on item 6, the PRPH funding?
What Nancy said was right on.
Would you mind just coming up and just giving us your name and count?
My name's Leslie, I'm from Patterson, and I just agree with what Nancy said, that if you have more money available and they're filling a need that you don't have right now, it just makes, makes everybody better off.
Thank you. Greg, did you have anything?
Well, I just wanted to make a motion that we, to approve an appropriate budgetary amendment or fund transfer by the Commissioner of Finance to provide $10,000 to PRPH from the subcontingency line.
Is there a second?
Second.
All in favor?
Aye.
Thank you. Okay, item number 7. 7 has 4 subsections to it. We'll take them one at a time, but at some point we may wind up merging them, which I think is fine. The first item, 7A, that is before you. This one does not have an additional. We'll get to that next. This is the approval to amend the legislative manual for public comment during legislative sessions and committee meetings prior to taking a vote. This has been something that Legislator Crowley's brought up a few months back, and we haven't punted the ball, but we've deliberated over the past few months, and I think it comes to a pretty good compromise. I'll just summarize the proposal in front of us tonight, which is certainly available to be debated and amended. But essentially, what it requires is, as we've been doing tonight and for the last couple of years anyway, of committee meetings anyway, before any vote is taken of an item on the agenda, there will be a period for public comment. And that's in the committee meetings, again, for those items that are on the agenda. And then the second corollary to this amendment to the legislative manual is in the full legislative meeting. If there's an item that has not gone through legislative process, and it, for instance, sometimes we have a message of necessity from the county executive that something has to be voted on in order to not miss a grant deadline, or if there's some physical emergency, some sort of storm or something where we might need to appropriate funds. In those instances, and only in those instances, and it's spelled out more in detail in this proposed 7A, that before a vote is taken in the full legislative session, that public comment will be had. The idea here is really to keep our committee process kind of freewheeling the way it has been. The way we discussed every item on the agenda tonight, and to reserve our full legislative meeting for passing or not those items that came out of committee. So this is an effort to do that. I'd be happy to, of course, open it up to discussion among my colleagues and the public. So with that, I'll first ask the committee if they have any comments. I see Bill has his hand up.
Thank you, Chairman. I'd like to ask counsel, page number 2 of this, in the blue, should we add special meetings in here, not just full legislative meetings? Because, for example, this year we've had multiple special meetings. Does this encompass that, or do we need to add that?
So through the chair, your typical monthly full legislative meeting is, as I understand it, defined as a regular meeting.
Correct.
Which would mean that a special meeting would also be considered a full. So using the term full would encompass both. That's my interpretation of this.
Okay. Thank you.
Bill, would it be, I'm not opposed to making it clear if there's a question.
That would be great. I would like to add, in addition to full legislative meetings, second line down toward the end, I'd like to add special meetings in there also.
Are you in D? And
Okay.
oh, here? Okay.
Full and special.
And special.
Second.
All in favor for that amendment?
Aye.
Okay.
Ask a question,
Yes.
just clarification on the
Yeah.
special meeting. So for example, we've had a few special meetings this year. So for the purposes of doing the business of the special, for example, sales tax, we had special meetings on that, which was discussed over and over and over and over and over again. So there was plenty of discussion on that. That was, so the special meeting was designated just to vote and get the business done that we'd already discussed. So you're asking for another rehashing during a special meeting to discuss the items, or is that something that hasn't been, or is it something that hasn't been? Because a special's called for a specific purpose.
Right.
that has been discussed, so I'm just trying to understand how that would fall into.
I think I can answer that.
Yeah.
Because you're absolutely right. Sometimes we could have a special meeting where the item that's being discussed has gone through committee.
Yeah.
But oftentimes we have a special meeting, not oftentimes, but sometimes we have a special meeting where something has not gone through the committee. But if you take a look at the paragraph B as in boy, it's the blue, in blue means addition, red means striking. If a draft resolution or local law has not gone through the committee process, but is being requested to be considered at a full, and I'll put, or special, Bill? In there, I'll put, or special meeting, as either pre-filed request pursuant to 5A9 or as a new business under 5A10, and following procedure. So there, I think that covers what you're talking about. So for instance, in the sales tax scenario, you're right, we did have several committee meetings where we did discuss that, and yet even after all those discussions, a special meeting was held. In that instance, this rule would not provide for the public to make any comments at a special meeting. The thought being that the public already had, in this case, many opportunities to comment on the sales tax. So I think that covers your, if it is a concern or your question. So it would only be in those instances where any type of full legislative meeting, as Conrad said, whether regular or special meeting is called, where if the item being voted upon has not gone through the committee process, at that point we would want input from the public. Because presumably there hadn't been any input from the public before. Does that clarify that? Okay. Bill? Yeah, good. Any other, Erin?
I just wanted to, B, which is now C,
Yeah.
to the extent possible, the chair of each full legislative meeting or committee meeting shall notify the public in advance of the meeting and agenda the designated time for public comment, providing reasonable access for the public to attend and participate in the meeting. So I originally wrote this, brought this several months ago. So what would be the procedure that would be implemented on this? Is this going to be at the start of every meeting, the chairman is going to then implement how many minutes they're going to give the public to speak, or is it how are you navigating through that? Because I had said, you know, I don't have my original on me, but you know, I had said I think it was 3 minutes if because of our time limit that we have in the building. 3 minutes per person, and then if we have a chance to get back to a person for a second time. I think I was a little bit more specific in that, just so it did give the public, everybody the chance to speak. If we had a packed house, which we had a lot of times, and people have come up more than once, and it gives them the time to speak, and it gives everybody the chance to speak. So how would you recommend that be handled the way it's currently written?
And again, I'm just 1 out of 9, but I think at this point, I think I'd leave it to the discretion of the chair. There was some discussion earlier, I think Nancy had brought up the phrase, you know, the chair would read the room, you know, in the sense that, you know, if there's 5 people here, well, let's let them go on for 5, 10, you know, however many, let's not limit them to 3.5. But if it's a jam-packed room and there's, you know, it's getting towards 10:30 at night, you know, at that point, it gives the chair some flexibility. And sitting here for almost 10 years, I know the public will chastise us if it seemed to be unfair as far as the minute allotment. So maybe in the future we could, if it doesn't work with the discretion of the chair, we could come back and have some more specific guidelines. But again, I'm just 1 out of 9. I'd be interested in hearing
I
what
just wanted,
others have to say about it.
sorry, through the chair. I just wanted to clarify, because like I said, this was my original resolution. I want to codify public comment and the you know, the live streaming and everything else. That's what I want. I want access for the public. That is very important to me. So I think that I just want to make sure that it's a fair process, and reading the room is fine. That's okay. I just want to make sure that everybody understands that there's going to be some sort of procedural, you know, rule or whatever if that becomes an issue.
Amy, then next.
I just want to just publicly state that I agree with Legislator Birmingham regarding reading the room and leaving it to the chair's discretion. You don't want to cut off anybody's comment immediately by saying you only have 2 or 3 minutes. You want to make sure that everybody has the opportunity to speak. Everybody has the opportunity to speak. So if there's one person that gets up and talks for 15 minutes and there's 20 people behind, it doesn't give everybody the opportunity to speak. So the more broadly we can leave it up to the chair, I think it should be in their discretion, so I would agree with that.
I think what you don't want to happen is to change the rule in the middle of the meeting, as is, you know, that's happened. So to read the room, understand the agenda, know what the hot topic is going to be, and we all know what's coming, usually before a meeting, we really do. So, you know, limiting that, and I think, you know, changing that rule in the middle, and you're the chair, you know, somebody's up there for 10 minutes, respectfully, I'm sorry, you're gonna have to wrap it up. You can do it in the middle of their comment, not for 50 seconds just because you don't like them, which has happened here also, but we don't, you know, if they're going on for 5 minutes, no, sorry. We have a whole room of people that need the floor too. So you're the chair. And there's trainings for this, you know, all over. Local government training for how to operate these kinds of things in meetings.
Great. Any other legislator?
I just
Yes,
want to
of
say
course.
I'm really happy that we're committed to transparency and public participation, and I'm glad to see that we're codifying this and we're here, so thank you.
Thank you. Any member of the public on this topic? No. So just to recap, we have in front of us as written, but we're adding, Beth, if we added the word special in 2 places, in the last recital clause on the second page, and then we're also adding under B the word special, second line to the right, full or special legislative meeting. Okay. As amended, I'll move this. Is there a second? Second. All in favor?
Aye.
Okay, great. Yay, it was A. Okay, B, for this, I'd like to make a motion to accept an additional. This is came from this is with respect, first of all, to the legislative manual, again, confirmation of appointments of the county executive. As you might know, the personnel department, Paul Eldridge and his team have given us some good advice on a lot of parts of the manual, but in particular this one with respect to confirmation of appointments of the county executive. Paul had asked that we amend the resolution before us tonight. It says Rule 33, but it's probably going to wind up being something else after we get through tonight's meeting. But anyway, I'll make a motion to accept the additional from Paul Eldridge. Do I have a second?
Second.
All in favor?
Aye.
Aye. Okay, this is, again, just for the public, again, the county legislature has the responsibility to confirm all department heads and agency heads that the county executive might appoint, with very few limited examples where we don't. And this merely just codifies a process under which we would do that. And essentially it just has 3 points to it. Following such referral, again, following such nomination, and the nomination shall be assigned by the chair to a standing committee, and the standing committee will request the following items for that nominee. And quite frankly, a lot of these are given to us anyway by not only this county executive, but all the county executives I've worked with. But again, it's just putting into place rules that, you know, will be clear. Written professional resume, 3 written references from persons engaged in the professional area of expertise to which the appointee is being considered. And then 3, a signed document stating whether such appointee has any interest in any contract with the county, and the words interest and contract are defined in the New York State General Municipal Law. That's A. Those are at least the 3 items we would request. And then the next process would be the standing committee. So for instance, this rules committee, we confirm certain department heads, we would hold a hearing and an interview publicly with the nominee. We would have to hold one, of course. And then C, at the conclusion of that standing committee, we would have to, as a committee, give one of the following 3 results to the full legislature for their consideration: to approve the appointment, to disapprove the appointment, or to make no recommendation. So this was put before us a few months ago. Paul Eldridge has requested that if you take a look at item A, the second bullet, again, this is the part that talks about 3 written references. He wants to append to the end of that the references to be maintained under confidential cover, not to be released to the public pursuant to the Public Officers Law, Section 89, Paragraph 2B, Romanet 1. Just to get it on the floor, I'll make that motion to amend. Do I have a second?
Second.
This is procedural, so I'll just, because we'll talk about it, I'll ask for a vote on this. All in favor?
Aye.
Okay. We have this rule in front of us as amended. Is there any committee discussion? Greg?
Yeah, I want to thank Legislator Montgomery. This has been her concept all along. that we get detailed information about everyone who we're gonna appoint, resume, background information, etc. When I was new to the legislature, that was one of the first things I remember she brought that up, and I'm in complete favor of this.
Any other committee comments?
Yeah, thank you.
Sure.
I'm not for or against it, but like devil's advocate here, every, not every, but many committees, we're looking for individuals to participate in these committees. And are we possibly making it more stringent, or should we make it less stringent for them to participate?
Well, the good thing about this rule, it's really narrowed down not to the committees that we talk about, for instance, the Fish and Game Board, the Cornell Cooperative Extension Board for your legislator, also the Plumbing Board, the Electric Board. None of this applies to that. This rule merely applies to nominations put before us by the county executive for, generally speaking, department heads and agency heads, commissioner level, director level. So it's, if I understand your question correctly, Bill, I think you might be thinking of maybe these more volunteer positions, like the Fish and Game. Rest assured, this does not apply to them.
Okay.
Because you're right, they are volunteers, and do we really want to? Now, having said that, I think Nancy had made the point, and that's a good one, we do want to see resumes for even those people. I don't want to open up the manual again, but, we might want to think about that in the future. But rest assured, this only applies to those paid county department heads or agency heads. Any other legislator have any comment?
Yeah, if I can just clarify that, and thank you, Legislator Ellner. It was a big concern of mine. There was a time when I was on this legislature with those volunteer boards, and I know that's not what we're talking about here, but we were appointing people based on, oh, he's a good guy. So these people do represent the county on various boards. We can see the results of that sometimes, what we had experienced over the past year with some of this. But, I wasn't so keen on this rule in the beginning, because I do feel like, it is the county executive's authority to hire and appoint who he wants. I remember going through this when I was on the town board, and the town clerk could appoint her. This was her thing. She could appoint her deputies. We couldn't even see their resumes or anything. That was her thing. But I did some research, and I think we have to balance government and work together. A county like Ulster County, their legislative rules include a process for confirming county executive appointments. They need advance notice for us. They must submit appointments in writing to the clerk of the legislature at least 30 days before the next scheduled meeting. Legislative action, the legislature is required to vote on the confirmation at least 30 days after the nomination. And if they fail to vote, the appointment is automatically deemed confirmed. But also a county like Nassau and Suffolk have procedures involving legislative committees that review executive appointments. Some even interview, like they have committees that will interview the executive appointments. So, I think this is designed to ensure transparency and accountability in the process of confirming appointments by the county executive. So after hesitating in the beginning, I am in support of this.
Great, thank you. Any other legislator comments on this? Any member of the public have any comments on this? Seeing none, I'll make a motion that we approve this for pre-filing to the full legislature in August. Do I have a second?
Second.
All in favor?
Aye.
Thank you. Item C is merely an FYI, and I'll tell you why I put it on the agenda tonight. This is the live streaming that we passed back in May. I'm not going to tinker with it, not going to change it at all, requests. I just want to let everybody know that this will be, and is right now, an additional part of our manual. But the reason I have it on the agenda is because the next item, first of all, FYI, any question on that? I mean, I'm not touching it, I'm not proposing to change it or anything. But the next item on the agenda, I'd like to, and Bill had brought this up at this committee several months ago. As we know, in the beginning of this year, January, there were many proposals made and passed to change the legislative manual. I made most, if not all of those, and Bill had made the point at this committee meeting a few months back that some of them were onerous, and upon reflection, I agree that some of them were, and still are. So he had made the suggestion to go back to the 2024 manual that we had adopted for that legislative year. And what I'd like to do is make a motion, just to put it on the floor, that we do that with the 3 new rules. We've 2 of which we've passed only out of this committee, and the one that we passed in May, so that we can have going forward, if it passes in August, have a brand new, well, not brand new, but the 2024 manual with these 3 new rules, and only revised as follows. You guys have this in front of you, I think you should. Take a look at page 3. The only suggested change I would make to the manual, the 2024 manual, is at the bottom of page 3 under item F. It currently reads adoption of the legislative manual. And we spoke about this at the last meeting, where unlike everything else that we talk about of substance, everything except the legislative manual generally goes through committee. And because our reorganization meeting happens at the beginning of each legislative year, we're not organized at that time. It's the first meeting in January. There's no chairman at the opening of the meeting. There's certainly no committees appointed at the beginning of the year. We don't have the opportunity to revise or we have the opportunity to revise, but we don't have the opportunity for the public to weigh in on any of those revisions because it hasn't gone through a legislative committee process. So my proposal would be, and only this change to the 2024 manual in addition to the 3 new rules, would be to change item F from adoption of legislative manual to presentation of legislative manual at the reorganization meeting. So again, just for some context, this is the order of business at our reorganization meeting each year. Item F would read as follows, and I'm going to, instead of saying adoption of the legislative manual, I want to say presentation of the legislative manual. The next order of business shall be the presentation of the legislative manual as in effect during the preceding year. The manual is the official guide to the rules, proceedings, and practices of the Putnam County Legislature. The rules of the county legislature for the preceding years as set forth in such legislative manual shall remain in force and effect until amended or revised following the submission of any amendment or revision to one of the standing committees of the legislature. So if this passes as written, what this would prohibit and prevent is what happened in January, where we did not have those amendments to the legislative manual go through committee hearings, because again, just by the process of time, there were no committees established. So what this would do is for each of the years going forward, when we reorganize, the legislative manual that's in effect the prior year would continue throughout the rest of the year until further amended, and it would only be amended following the committee process. So that was my intent in changing item F. The only change I would make to what's written before you is instead of saying Beth, adoption of legislative manual, just make presentation of legislative manual and keep the red and blue the way they are. So that's my thoughts behind that. Any comments from the committee? Greg? And then Bill.
Thank you, Chairman. I think it's a great idea because we're in July and we're still discussing this.
Yep.
7 months is a long time to talk about a manual, so it's a good idea. Thank you.
It was a noble experiment.
Yes.
Greg?
Dan, if I'm understanding correctly, is we're going back to the 2024 manual? This is without any changes?
No. We're going
Other
back,
than the 3 changes?
and the change I just mentioned.
What about all those other changes which we debated ad nauseum for all those months?
We never did those in committee meetings.
Yeah, but we voted on them as a whole.
Right. No, that's fine. Just to give some clarity here, they were voted on at the full committee meetings.
They were at the full ledge meeting, so they were passed.
Yes, they were passed, but I think that's the chicken and the egg here. The complaint that I didn't recognize back in January, which I think is a legitimate complaint upon reflection, is that those legislative changes to the manual did not go through the committee process. And upon reflection, and again, we're all willing to get smarter, and I'm certainly willing to get smarter. I think if we do want to reintroduce those items, we should do those in a committee hearing.
I understand what you're saying, but I have a problem with this because those changes were adopted by the full legislature.
Right. And if this passes out of committee tonight, it will go to the full legislature again in August to be voted on. So the same body that approved it in January with those new changes will be the same people that will either vote or not on this in August.
Okay, I'm not comfortable with this at all.
Okay. Erin?
So after that did come up in committee, or at the full legislature, there wasn't really a lot of, I mean, there was discussion, but there was no public comment at all that could weigh in on any of it. Also, Paul Eldridge and the law department had to weigh on certain things that HIPAA was included, medical issues were included that were not looked at and could be a problem or perhaps a lawsuit. And also, we all voted to table those things until October or November.
Well, yes.
As a body. So even though they were voted on, we all voted as a body to table it until October or November.
If I could, just to clarify that point, there were 2 or 3 of the rules which we voted to hold in abeyance or have a moratorium on until July 15th, which were passed on. There was the other one, the last one was the order of seating for the presentation of either the State of the County address or the county budget. That one was October 15th. If this passes in August, as with these 3 and then this change, none of those will be existing anymore. It'll be the 2024 manual with these 3 new rules and plus the tinkering around with the presentation of the legislative manual.
Perfect. Thank you very much, Chairman.
Yes.
I don't have a problem with that, going back to 2024 with these changes. I think we can look at those changes, and if there's something that's really is imperative that we feel should be included, we can discuss that at the August Rules Committee meeting and implement changes. I mean, we can still amend and make changes to this document throughout the year.
Yes, and the good thing about the new revised item F is that they will have, any amendments and revisions will have to go through a committee process, which will by definition require public input.
Okay, I do have a question about this change that you have in here.
Yes.
The adoption of the legislative manual.
Well, it's now changed to presentation of the legislative
Right, which wasn't changed. In F, it says adoption of the legislative manual.
I'm going to make that amendment here tonight, yeah.
Right, so that's what I want
title.
clarity on.
The title, yeah.
The title doesn't. Anyway, so are we never going to adopt it? It's always going to be presentation? Or are we going to adopt it at the February, after the organizational meeting?
We could do either. The spirit behind this would be to have the legislative manual keep going without change until it's changed by a committee meeting. So in other words, you're right, for the last 50 years almost, every new legislative year, we've adopted a new legislative manual, but quite frankly,
it hasn't changed.
It hasn't changed in many of those years, if not the great majority of them. And when we do make changes, and again, except for the exception of this year in January, the changes have gone through the committee process. So what this does is it will bring the legislative manual that was in effect the year prior, just say that it's still in effect until changed further. So that doesn't really limit the legislature from changing it, because we have the power to do that as a legislature, but we would have to do it in a committee as opposed to doing it at the first meeting of the legislative year, where by dint of organization, there are no committees at that point.
So just to be clear, every year at the organizational meeting, the legislative manual that we will be presented is the one that was changed either, I'm just throwing out arbitrary dates, September of the previous year.
Or
we had changes in that.
Or 6 years prior. It could be a very unchanged
Right.
document. It would just be this is the legislative manual.
So 10 years from now, we could say it was the adoption of the legislative manual from, August of 2025.
Yeah.
I mean, it could just go forward.
Yeah, and it would just be amended as if need be, as we go along. It would just be a recognition in the legislative reorganization meeting that this is our legislative manual, and nothing other than that. And if we want to change it, this gives us the way to do it. It has to be through committee meetings.
Okay, so it's not an adoption.
I just want to get legal counsel, and then I'll go to you, Nancy.
Through the chair, I think you would also have to change Rule 24B, which mentions the adoption of the manual.
Good eye. 24B?
24B.
What was that?
24B.
Page 23.
I see it. So what would your suggestion be there, Conrad? Okay, I guess maybe, it's 24B rules reads as follows. The rules of the legislature for the preceding year shall remain in effect at the first meeting of each year and until formal adoption of the, so maybe strike it from and until formal adoption?
I think so.
Okay, so Beth, you see where we are?
Mm-hmm.
Bottom of page 23. So it'll essentially echo what's in F right now. So we're going to strike everything after the words each year at the bottom of that line. We're going to put a period at the end of each year.
Okay.
And strike in until formal adoption of the rules for the current fiscal year. So what that does is it takes away the necessity to make us think we have to adopt it each year. Nancy?
I really appreciate all the work you've done on this, and I know you've done a lot of work, and I'm completely opposed to this, because...
To the manual?
To these actions that you want to take now, because the full legislative meeting, the first one of the year, is the only opportunity I have, being the one that's not on the committee, to make any changes to this. So I would not be in favor of this at all. Like that first meeting is the only time I have a chance to make any changes to this.
To vote in a committee, well, to vote on it, yeah, you're right. Well, if there were any, I mean, I think there's a workaround here that we could work on. If there is any change to the manual, though, as a member of the legislature, you would have the opportunity to vote.
I wouldn't be able to propose any changes.
Okay, that's a fair point. How about this? How about?
Sorry.
No,
I know you worked very hard.
No. This is. I'm a nerd. This stuff gets me excited. Well, how about this? How about
Mr. Chairman? I think one of the big problems which we have here is we do not have legislative counsel.
I don't know.
And this would have been a lot easier throughout the year if we had routine access, as every other legislature in the past has had, to legislative counsel. We could have straightened all this out. For my 3 years on the legislature, the first 2 years we were able to adopt the manual at the first meeting. This is the first time that we were unable to do this, and we didn't have legislative counsel. So,
no, we did
again,
have let's not do any cross-talk and let's wait to be recognized before speaking. How about this? Let's go back to item F, or paragraph F. The next order of business shall be, oh, wait a second, Nancy. If we include the new rule that says anything that hasn't gone through committee has to be, has to include public comment. If the legislative manual hasn't gone through, if we adopt the rules that we talked about 2 items ago, the legislative manual hasn't gone through the committee process at that organizational meeting. So in that sense, it hasn't gone through the committee process. So then, but that's only the public speaking. That's not your opportunity to amend it. But you would have that opportunity as a committee member of the full committee, the full legislature. I'm happy to change. I'm not trying to shoot you down.
No, I'm
pondering.
I'm not all there with it, so I need some time.
Do you want to? I mean, I'm up for suggestions. I mean, I don't want to shut you down. What do you think? Why don't we do this? I mean, I want to leave F the way it is.
For now.
For now, and just pass the 2024 manual with the 3 additions. I mean, I'm up for suggestions.
I mean, we all represent about 11,000 constituents.
Yeah.
Why shouldn't everybody be on a committee?
Well, let's stick to the
I'm just
legislative
saying that
manual.
could be a legislative manual change in a rule.
Well, all right.
Just saying.
We could propose that.
Sure.
You will.
How would you vote on it?
I'm just saying it's equitable and it's honest and it's the truth. I don't care what party you belong to. We still represent 11,000 people that we are elected by.
No argument here. But let's not make the perfect the enemy of the good. Let's try and get something out at a committee tonight. Why don't we do this? We can always come back, because this is our favorite subject, to talk about the legislative manual. Why don't we, instead of amending F the way I proposed it, trying to be helpful, I think I was trying to be helpful, but I see your point. I'll amend my motion to adopt the 2024 manual and just say to adopt the 2024 manual as is, without any of the red and the blue that I put in there. So essentially now, I'm making a motion to pre-file to the full legislature the 2024 manual unamended with these 3 new rules. Do I have a second?
Yes.
Okay. Any discussion on that? Okay. Any discussion among the legislators?
Thank you.
Sure, of
Thanks
course.
again for
Happy
all
to
your
do
work on it.
Any member of the public? Are we boring you to tears? Everybody still awake? You still with us?
Yes.
Okay. Hearing no other comment, I'll make that, we've made that motion and it's been seconded. Do a roll call vote, please.
Legislator Ellner?
No.
Legislator Gouldman?
Yes.
Chairman Birmingham?
Yes. Okay, thank you. Item number 7 is the litigation report. It's an FYI, as I mentioned at the beginning of the meeting. This is for the legislators. It's just for the public, though. It's a general compilation of the litigation that the county is involved in. It is a confidential document, so this is one of the few items in a committee meeting where we will not be asking for public comment or taking any. I trust you can understand why, but this is just a way for the county attorney's office to keep the legislators abreast of all litigation from the county. And I would recommend my colleagues shred this in shredder at the end. To the extent there's any legislative comments, we should do that in executive session. I don't think we have any, though. Seeing none, that's just an FYI. Item number 9, and no other business with respect to any item on the agenda. Seeing none, I'll make a motion to adjourn. Second.
Are we taking public comments?
There's
Other business?
Well, other business is, as I said at the beginning of the meeting, other business is dealing with only those items within the bailiwick of the Rules Committee. And those other business items will be coming from legislators, from the legislator that's given another additional
So I
business.
can't speak.
There's a lot of
Sure you
people-
can speak,
There's a lot.
but you can speak about during when we, please wait to be recognized.
I can only speak on items on the agenda?
Exactly, yes.
So how do we enter something into the agenda?
You would go through the appropriate, well, first of all, the agenda is set 5 days before, so you want to make sure you hit that deadline. You can reach out to the clerk's office. You can ask to have things put on the agenda. It's up to the discretion of each committee chair whether or not something appears on the committee agenda. I will make note, though, that this Rules Committee meeting and every committee has a certain amount of portfolios that they're in charge of. They can only, we speak about county issues, and county issues generally are what gets entertained at committee meetings.
Well, my comments.
Well,
yeah.
sir, again, that's the process.
Well, I'm asking for your permission.
Okay.
My comments, I believe, touch on the rules and intergovernmental relations.
But do they touch on any items on the agenda?
No.
Yes.
Okay, well then, thank you.
Yes?
What you just said.
Well, first of all, hang on. After each item on the agenda, you will all, except for the litigation item we just finished, I asked, is there any comment from the public
We
on
were
this?
waiting for the end, because we thought that that was the time for it, it wasn't clear.
Okay,
It
it's
says
clear
nine
now then.
other business.
It's clear now
Even
then.
here,
Yeah, we were observing protocol.
I know you were.
Being polite, and
Yep.
I've been here for 3 hours now.
Go ahead.
No, well, this is where we are. It's, if you'd like to make a comment
Well,
on
I'm going
an
to say
agenda.
that it's.
Well, no, sir, hang
Yeah.
on. Just to be clear, we're only speaking about items on the agenda tonight.
All right, and I understand this will go into the record.
It will not, if it's not
The
on an agenda.
statement I'm making is that.
Well, sir,
come to my attention-
sir.
Yes.
First of all, I need you to identify which item on the agenda you're speaking on.
Okay.
The manual.
Okay.
Okay, legislative manual. Yeah, sure, legislative manual, which, in all honesty, I haven't read.
Okay.
But my guess is that somewhere in there, my comments will be relevant.
Sir?
Yes.
No, sir, I won't allow you to use this legislative manual as an excuse to speak about something that has nothing to do with, I'm asking, is this going to have anything to do with the legislative manual?
Yes.
Which part of the legislative manual, which you said you haven't read?
Conduct.
That's not in the legislative manual, sir. Take a look at it.
Yeah, I'll have to get a copy.
It's on the website.
If I want to address an issue of ethics, is there some way
We
I
have an
can
ethics
dovetail
board.
into one of those agenda items?
We have an ethics board.
And
the
how
county
do I
does.
address an ethical issue with the ethics board?
They have a website.
I've got it, yeah, and,
Yeah, go on the website and call.
good. Well, I presume if I just began talking, you would stonewall me or?
No, not at all. I would
stop
preserve the
speaking?
quorum of the meeting, and I would ask you what item on the agenda you're speaking to.
I don't know.
Okay, well then, we're at the end of the meeting. If you have an item on the agenda to speak on, even though we've finished all the items, I'm willing to let you speak on an item on the agenda.
Okay, and assuming I'm not gonna speak on an item on the agenda, and I yet begin speaking, will the officer drag me out of the building?
I certainly hope not. I wouldn't think so, no. What I would ask,
Because I'm a
though,
nonviolent person.
sir,
Yes.
if you have nothing to speak on the item, on an item on the agenda, I would ask that we adjourn the meeting, or if anybody else has an item to speak on the agenda.
Make the statement.
Let me study the agenda.
Is there an item, do you have an item on the agenda?
No, what I was going to say is, after you adjourn the meeting, there's enough people here, I'd be happy to stay
All right, well, I
and
will say
listen to
this.
whatever they say.
I have sent you all a letter. You'll get it within the next day or two. Please read it.
Will do. Thank you.
Good. Great.
Any other business on the agenda?
I'd like to see a show of hands of anybody who knows Jake Thomas.
That's not on the agenda, ma'am. It's out of order.
Well, we've been here a long time, and we're very concerned.
Ma'am, can I ask you to speak on an item on the agenda?
I believe it has to do with the rules. that-
Which rule in
the
particular?
legislative manual. I do not know your rule.
Okay, well then maybe take a look at it and then you can speak about it.
One of the members is present.
Ma'am, you need to speak on an item on the agenda.
Her phone number was.
Ma'am, you need to speak on an item on the agenda.
Is integrity of the legislature on the agenda?
Do you see it up there, sir?
Individual integrity or collective integrity of the legislature? I'm reading it. I
Yeah.
don't, I guess not.
Well, I'll make a motion.
So I guess integrity is not to be considered tonight.
Thank you. Any other
Perhaps,
business?
if ever.
Hearing none, I'll make a motion to adjourn. Is there a second? All in favor? Aye. Thanks, folks, for staying tonight. We really appreciate your time. Thank you.
Anyone